Hello, this is Annette Frankie. It is wonderful to join you virtually for this Young Adult Retirement Summit. As a first ever Hispanic board chair of ARP, and as someone who works in finance, I am deeply encouraged by your engagement in the topic of obtaining a secure retirement so far in advance of when you will retire. At ARP, we are dedicated to helping people build savings and manage debt, helping them make sound financial decisions that will promote and sustain financial health for themselves and their families at any age. It is always important to stay on that path, and it's never too soon to start. This is certainly true in the Hispanic Latino community, where the median age is 30 years. As we say in our advertising, the younger you are, the more you need AARP. At this time, when the pandemic has added new financial stress for so many families and intensified existing financial problems, it is especially important for people to take the steps they can to restore or sustain financial health. Hispanics are a major focus of our work on financial security. That includes research into the views of the community and reaching out with information and support. We recognize that when it comes to financial security, as in other areas, there is a diversity of outlook and conditions among all of the different groups that comprise the Hispanic Latino community. At the same time, there are valuable overall findings in our recent research. For example, we found that just 28% of Hispanic workers ages 25 to 44 have a savings account, and just 60% have a checking account. For non-Hispanic whites, the figures are starkly different. 52% have a savings account and 85% have a checking account. We also found that whereas 59% of non-Hispanic white workers 25 to 44 who are employed have an employer-provided retirement account, just 30% of Hispanics of that age group have one. One area where ARP has been deeply engaged is advocating for state legislation to expand opportunities for workers to save on the job through retirement accounts. The Hispanic Latino community has a great deal at stake here. People are 15 times more likely to save for retirement if they have a way to save by payroll deduction through a 401k or other workplace retirement plan. While the statistics are compelling, I also speak from personal experience. My mom, who entered the workforce late as a non-college educated woman, was able to save a significant amount of money because she worked for a company that had a 401k plan. When we look at the vast difference in net worth between Hispanics and non-Hispanic whites, we also need to consider the effect of stock holdings. The Federal Reserve reports that as of 2019, only 24% of Hispanic families own some form of stock, compared to 61% of non-Hispanic white families. And even though Hispanics 25 to 44 are much less likely than non-Hispanic whites to have savings or checking accounts or to have a saving mechanism, they are more likely than whites to say they will be financially secure in retirement. Optimism can be a key ingredient for financial security, but we also know it's not the whole recipe. It should be mixed in with planning and saving. We also asked how important it was to be able to provide financial help to loved ones. I'm sure it won't surprise you that the figure for the Hispanic community was relatively high. 56% of Hispanics, compared to 35% of non-Hispanic whites, said it was very important to provide financial help to loved ones. This is an important finding in many respects. It means, for example, that there can be a very healthy multiplier effect when millennial Hispanic Latinos get the right information on finances. You can use that information to benefit yourselves and others in your family. Hispanic Latino millennials have such a pivotal role to play, helping older family members navigate systems and services and taking part in crucial conversations on family finances. When I think about financial health across the generations, I think of a bedrock of financial security, and that is Social Security. As ARP looks ahead to a serious Social Security conversation on Capitol Hill in the coming years, we believe strongly that the conversation should include all generations. At the same time, we know many younger people don't fully understand the program's value to them and their family. And to address that information gap, ARP teams in 8 states are exploring different ways to engage younger audiences, including Hispanic Latino audiences in Arizona and Texas. I'll close where I began. It is great that you are thinking ahead by taking part in this event. ARP is also thinking ahead with you, and we have the resources to help you get where you want to go. If you go to www.arp.org/money or www.arp.org/dinero, you'll find lots of helpful information and tips. You can also go to aceyourretirement.org to learn about how to save more for retirement and get tips in just 3 minutes. If you have an unplanned expense like a medical bill or a car repair, or you want to manage all of your debts in one place, you can go to ARP Money Map for a step-by-step action plan to get your finances on track. You can count on ARP for information and advocacy that make a difference. We look forward to working with Hispanic Latino millennials so that you and your families will enjoy a secure retirement. And when it comes to financial security, saber es poder. Thank you very much.
Hi, I'm Jasmine Wigfall, Legislative Director of Social Security Works, and welcome to your first lesson in SOAR, Social Security 101. Through our travels, we've found that the most popular thing that advocates want to learn about is the basics of Social Security. We all grow up learning a little bit about Social Security in school, but the ins and outs are kind of complex, and we might need some help understanding all of those things before we go out and advocate for our Social Security system. And so, we're really lucky to be joined today by two wonderful experts in the field who are going to help us on this journey to learn more about the basics of Social Security. So first, we're joined by Nancy Altman, who is the co-founder and president of Social Security Works, and Abigail Zapote, our very good friend, who is the president and CEO of Latinos for Secure Retirement. So welcome to Nancy and Abigail.
Thank you so much for having us.
Yeah, so let's jump right in. We have an outline of questions, and I think that our trainees here are going to be really well informed by what we talk about. So to start, what is Social Security? I know that there's a lot of different things that the program does, a lot of ways that we can talk about it, but each of us has our own definition, and I'd love to hear yours. So let's start with Abigail. How would you define what Social Security is?
Sure. I think that inherently Social Security is a pact that we all have as Americans, but also that we have as intergenerational communities across the country. Not only does this program serve older adults, but it also serves anybody who becomes disabled, anybody who is a widow or a widower, and especially all those children who are also affected if their parents, unfortunately pass away or if their parent is disabled. It is a great program that builds on, I would say, love and generosity from all aspects of the country. So it's just a really great program that I think really builds on the unity that we that showcases Social Security as a whole.
Yeah, I love that answer. Nancy?
Yeah, Social Security is a benefit that all of us earn through work. It's insurance. As Abby says, it's life insurance, it's disability insurance, and in technical terms, it's called a joint and survivor retirement annuity. It's a monthly retirement income that lasts through one's lifetime and one's spouse's lifetime. It's really, think of it as we get, when we work, we get our wages. We also get insurance against the loss of those wages. It's a kind of deferred compensation. So Social Security is something we pay for, we earn, and and we're all in it together.
That's great. Both of you pointed out one of the things I think is super important to talk about, which is the unity of it, right? That we all pay into it and we all benefit from it. One of my favorite things to talk about is the fact that it's insurance as well, which Nancy brought up. We think about insurance in so many aspects of our life, like having house insurance and home insurance, or having insurance for our vehicles in case something happens. And those are really easy concepts for people to understand. If something happens, like your house is flooded, or if you're in a car accident and you have to have repairs, we know that our insurance is there for us at any point throughout our life. And so that's exactly what Social Security is. It's insurance against wage loss. So I think those are really good answers. So to take us back into history, we're going to turn to Nancy for a moment. Nancy has a wealth of information about how Social Security was started. And so let's start with, what was the original intent of Social Security? What were the creators and the founders of our Social Security system thinking when they created it? So Nancy, can you give us a little bit of insight into that?
Absolutely. In fact, really what they were intending then is what it is today. And that is that it was enacted in 1935. So President Roosevelt was elected in 1932. He immediately had to deal with the banking crisis and with all kinds of crises. But as soon as he was able to get the banks, bank holiday and banks reopened and take care of securities and exchange and all of that, he turned to worker security. He knew that, it was the middle of the Great Depression. People were on the streets, there were food lines, people had nothing. He knew that to get immediate help to people, he needed to get welfare, and he enacted a number of welfare programs. But for the long term, he wanted a program there, an institution that would be there in good times and in bad times. And in good times for the economy, bad times for the economy, good times for individuals and bad times for individuals. Any of us can walk out in the street and get hit by a truck and have a disabling accident and no longer work, no matter what the economy is. And then we could go through a period, the Great Recession or the current recession caused by the pandemic, and through no fault of your own, your wages are lost. So to have this in place for the long term, they set it up, the Social Security, because you had to become insured. You didn't get benefits right away. So even though it was enacted in 1935, the first benefits weren't paid out until 1940. Originally, it was going to be 1942, and they moved it to 1940, but they understood that it was a beginning on which to build.
Yeah, that's important as well. We'll talk a little later about ways that we can build on our Social Security system. But to stick back in 1935 for now, I wanted to talk a little bit about how Social Security is different from the ways it was in 1935, because it has been built on a little bit in the past. So can Nancy, you explain a little more about how the system is different today than it was in 1935?
Yes. President Roosevelt saw it. He put together a committee called the Committee on Economic Security in June of 1934. They had just 6 months to act, and they put together Social Security. They looked at what we today would call Medicare for all, guaranteed health insurance, long-term disability, short-term disability, sick leave, a whole host of programs, but they decided to start with the old age insurance where the need was so acute, because hidden in the shadows of Social Security unemployment were 3 generations. There were, of course, the children of workers, but at that time, virtually everyone who was old, once they couldn't work anymore, moved in with their adult children. If they didn't have children who could take them in, they literally went to the poorhouse. So it was a very acute concern. In 1935, they enacted old age insurance. In 1939, just 40 years later, they expanded it to really be family protection, to provide protection for spouses and widows. And they also increased the benefits in the short range. Then we had World War II, and so things stopped. But then they continued starting in 1950 to incrementally expand who was covered by it. 1956, long-term disability insurance was added. 1965, Medicare was added, but really very little progress was made after 1972 when benefits were automatically indexed. So it's been a very long time since Social Security has been expanded, but the intent was to keep building on this framework, the structure of earned benefits, wage-related benefits, set aside in a trust to which we all contribute and from which we all draw.
Yeah, that's something you write about a lot in all of your writings, Nancy, that FDR was intentional when he signed Social Security into law about it being I believe he says, cornerstone in a structure, and that it was intentional that the structure was not complete yet, that we were supposed to continue to build on it with every generation and continue to expand it. And again, we'll talk about that more later, so I don't want to jump ahead. But
If I can say just one thing on that, that you sometimes see headlines or columnists saying, oh, Franklin Roosevelt, if he came back today, he'd never recognize the program. And what I always say, and I think is true, he'd recognize the program, but he'd be shocked that we didn't have more, that we didn't have Medicare for all, that we didn't have short-term disability. So it really built on this structure. They were very ingenious, and they really understood the people they served, and they put together a program that has stood the test of time.
That's for sure. So Abigail, I want to turn to you to talk about the also intentionality of the founders in making it an insurance system and rather than a personal saving system, which I think that a lot of people are familiar with. You know, we have 401ks where we invest and our employer invests some. We have our personal savings, our bank account. And so people are familiar with those things, but Social Security is intentionally insurance. And so why do you think that they decided to do that when they created Social Security?
Sure. And I think, thank you so much, Nancy, for providing that great historical context. And I think to add a little bit more to that is adding and kind of making it relatable to the folks that are viewing this this series today, is that the program also was born out of a response to the 1918 flu pandemic. I mean, our country 100 years ago was also facing something very similar. And I would say we're probably seeing something even worse than they did back in the 1918s. The country then went through the Great Depression. And obviously, I think we've all seen, especially now during COVID-19, that a lot of older adults have lost their jobs. And as well as folks that might be close to retirement. And so I think the intent of the law was to ensure that folks that were older, that were put in poorhouses back then, that didn't happen in future generations. And so the insurance piece allows for all of us to contribute into the program, and that that it is this intergenerational movement to ensure, again, and I keep saying ensure because that's what it is. It's an insurance program to ensure that at the end of our lifetimes or at the end of our working lives, that there is something there that can protect all of us. And like Nancy mentioned, if anything tragic happens to our families, to where we become one of those vulnerable people, that there is something that we can fall back on as a safety net. I know that we'll be talking about later in the program about how we can reinforce that safety net, but I think it is just something for us as a pact as Americans. And I will add that as a new American, I became a naturalized citizen a year ago. And to me, that was just very important that I could also be included in this program, because I think one of the things that should be highlighted as a progression of the program is that it did exclude Black Americans when it was first enacted. And now, obviously, Black Americans are included in Social Security. The other thing is that undocumented Americans right now are excluded from the program, even though they are paying into the system. So there are more things that that can be included, that can be expanded, that will come at a later time in the session. But just to reiterate that it is an insurance program that we should all know that from the time that we start paying our FICA taxes, whether that's at 16 when we first get our first jobs, to now when we're in our careers, or when we're those 10 years away from applying to Social Security, ensuring that we're collecting our 4 credits to ensure that we do get the maximum benefit when we do retire. So it's just a great program. Again, to ensure that we have money to survive on into our golden years.
Yeah, I think one of the central messages is that we can't do it by ourselves.
Mm-hmm.
We value community in our nation. That's something that we value a lot, is making sure that our neighbors are taken care of.
Mm-hmm.
We want to make sure that our grandparents, that our grandchildren, that our generation, that we all have something to keep us afloat in hard times. And so I think that's one of the reasons as well, like you said, that Social Security is created as an insurance system rather than personal savings system. So
I think
go
that was
ahead.
very, very well said. And I think, I sometimes say to young people who, when we talk about it, savings are always important. It's always, especially for short-term needs, but you need insurance for things that are that actuaries can understand for a group, but that are unpredictable. So if you say to a 20-year-old, well, how long do you plan to live? How are you supposed to answer that question? If they live only to 50 and get struck by cancer, they don't need retirement income. They're not going to live long enough to get retirement income. If they live to 110, they're going to need a lot of retirement income. That's something that actuaries can understand for groups, but not for individuals. That's the whole idea of insurance, that we're pooling our risk. And that's what Social Security is. We are all pooling our risk. And that makes sense, as Jasmine says, because we are one community.
And I would also like to add as well that, especially now during very hard economic times for large swaths of the population in the United States right now, it's very hard to save in a 401k if your job does offer a 401k. And unfortunately, especially within the Latino community, and I would say in a lot of different communities as well, that work in jobs that don't offer these programs, it makes it so much harder to be able to save up for retirement or to save up for an emergency. So to have a program that is already inherently present, when we receive our paychecks, that you're already putting in your insurance premium, that ensures that, if anything happens to you, you are insured if you become vulnerable. So I think at the end of the day, it's just really great to know that you are already insured when you start working. And if you can save through a 401k or through any other means, that just means that you're just making your retirement savings even more robust. So, I encourage both. But again, it's just nice to be able to have Social Security there as a safety net as well.
And if I can, I think, Abby, that was extremely well stated. And if I can just add to that, Social Security, if you look at all the various sources of retirement income, Social Security is more efficient than any of them. It spends less than a penny of every dollar on administration. More than 99 cents is returned in benefits. It's more secure. It's backed by the full faith and credit of the United States. It is portable. You can carry it from job to job. It is strikingly superior to private pensions and to private savings. And so it makes sense. It's the one pillar that works so well that we should be expanding it, given that people in the future are going to rely on it more, given what's happened with the inadequacy of savings and the decline of employer-provided pensions.
Yeah, you guys are going to give our trainees a lot of good information. So I just want to make sure that they know that we will have resources that are written down at the end of this for you guys to have all of this in written form again, because there's so much good information in this, and we're excited for you to take this to your members of Congress and to your friends and family to teach them more about Social Security. So I want to move on to something that we've kind of implied about a couple of times through this conversation, but not touched on directly. Social Security is paid for by workers, but it doesn't just help the worker. Social Security is a family program. And so, Abigail, I was hoping you could talk about this because your organization does a lot of work around the fact that Social Security is intergenerational and that it does help the entire family. So can you talk about that aspect of Social Security?
Sure. So I will just kind of give a little bit of background on just the work that we do, but in the sense of why we do this intergenerational work. Currently, the median age of a Latino in the United States is about 29, 30 years old. So our community is still fairly young. And I believe it's only about 13% of the Latino community who is of retirement age right now and who's utilizing Social Security benefits. And so, our community is still in that understanding, like all of us, really trying to understand how Social Security works. I think for a lot of us, and especially in the immigrant community, see Social Security as just your 9 digits and your card, to be able to get protections when you're working, but it's so much more than that. And it really is that, and what we try to share with folks is that the time that you're working and the time that you're, putting money into this program, into the Social Security Trust Fund, it is to ensure that not only our grandparents have a safe retirement, but that our parents do as well, that we have a good retirement when we do become the age to retire, and for our children, if anything happens to us. And I think one of the myths that we all think is that this program is only available for people who are older and who are ready to retire, but that's not true. As I mentioned earlier in my statement, this program is available for anybody who has a loss in their family. If there is, if you're a 29-year-old person who has a family and your spouse passes away, you can have that widower benefit to be able to help your family as you are raising those children. And the children will also be able to get a benefit as well because they had a parent who is deceased. Again, if someone in the family has a disability, they're also eligible for Social Security benefits. And I will say, if there is also, if there is unfortunately, and I will say one of my cousins has a mental disability, and so he is also eligible for supplemental security insurance, which is another part of the Social Security system as well. And so this is a program that can affect the entire family as a whole. And again, it is that it does include those grandparents who are protected if they become too old to continue working. And I think this is also important to note as well for workers who work in jobs that really beat up their body, like construction workers or anything like that. If they become disabled, they are also protected by this program. And so I would just say that, to just continue to reiterate that this is a family program to protect all of us in the case that we do become vulnerable to any of life's misgivings.
That was a really great summary. I too can identify with that in my own family, whether it be from family members who have lost their parents at a young age or family members who I know who have become disabled before their retirement age. They have depended on Social Security benefits to survive. And that's the story of so many families across our country. And then added just today with the death of over 400,000 people due to COVID, we know that there will be families who they will now depend on Social Security for their income. And so it's becoming even more important in our society, and we have to protect those benefits for families, for kids, for grandparents, for everyone, because they are so important. So I want to get into talking about the financing of Social Security, because one of the biggest myths that I hear all the time is that Social Security is going bankrupt. It's a nasty myth that has spread all across the country, from members of Congress to anyone just walking down the street could think this. And so I think we should dispel this myth today, right now. So I want to turn to Nancy to tell us, is Social Security going bankrupt?
No. Social Security is extremely affordable. We spend about 5% of our gross domestic product on Social Security. At the end of the century, 2100, we'll be spending 6%. We're not talking about much change at all. It's basically a level amount. It is really a question of values, not affordability. Most other industrialized countries spend much more on their counterpart Social Security programs than we do. This has been a myth. The reason that it's gaining traction is because of a misunderstanding of the way pension plans work, which is what Social Security is. In private pensions, everyone understands that employers set the money aside in a trust, and then benefits are paid from that trust. The same thing happens with Social Security. There are trust funds that the money is held in trust for America's workers. And most private pensions project out about 10 years to 20 years. Germany projects out on its Social Security program about 25 years. The United States projects out not 25 years, not 50 years, but 3/4 of a century. The program's only been around for 85 years. So whenever you project out that far, sometimes you're going to show a little an unintended surplus. Sometimes you're going to show an unintended shortfall way out in the distance, and then you make adjustments in terms of bringing in more revenue. So that there is a very manageable shortfall way out in the distance. Congress has lots of time to act. There are many efforts in Congress to expand benefits and fully pay for those expansions and the modest shortfall that we have. But there's no way the program can go bankrupt. It's kind of like saying, can the Defense Department go bankrupt? This is a government program backed by the full faith and credit of the United States. So it's here to stay. It would take an act of Congress to get rid of it. So the question is, do we want to expand it or do we want to cut it? But it's a matter, as I say, of values. There is no need to cut it. In fact, there's a lot of reason to expand it.
Agreed. Now, one of the things you touched on a little bit was the trust fund. So if anyone's ever reading about the Social Security trust funds, they will notice that there are two. There is the Old Age and Survivors Insurance Trust Fund, and then there's a trust fund that covers the Social Security disability insurance. But those two trust funds are all part of the same program. So Nancy, can you clarify a little bit how that works, why there are two, and how they are all part of the Social Security system together?
Yes, in fact, sometimes I joke, and the people who are part of this program can think of themselves, people talk about trust fund babies, and we all think about, Warren Buffett or Bill Gates or somebody, his children are trust fund babies. We actually all are trust fund babies. This money is held in trust. It is not the government's money. It's our money, which we have earned and we have contributed to this program. There are trustees that are investing this money. Here's a confusion that people have, but it is invested. Congress has said private pensions are sometimes invested in securities as well as stock. Congress has said from the very beginning, it wants the workers' money and their working families' money to be invested in the safest investment on earth, so it cannot be lost. And that's Treasury bonds backed by the full faith and credit of the United States. So Social Security is a creditor of the federal government. There are two trusts because in 1956, when disability insurance was started, some who are doing it were concerned about the cost. It's an unusual benefit in private insurance because private insurance has had trouble with it, and they wanted to monitor it closely. It's now been since 1956 that we've had this. When the trustees and the actuaries report to Congress, they often treat it as one trust fund, even though it is technically two separate trust funds. And it's time that the trust funds were combined into one. That is something that has been proposed legislatively, and I think makes a lot of sense. But all of the money is, and in fact, you can have people with disabilities who are drawing from the Old Age Survivors Insurance Trust Fund because if a worker dies and the children are receiving benefits, they receive them until age 18 or 19 in high school. It used to be they could receive them until age 22 if they were in post-secondary school, but that got changed in 1981. But if they develop a disability before age 22, the idea is that we all take the place of the parent, and so then they continue to receive children's benefits. By the same token, people who receive disability benefits when they reach their full retirement age, they don't know any different. Nobody sends them a notice. There's no reason that they not need to know, but for accounting purposes, they begin to receive benefits from the old age survivors insurance trust fund. So the funds are tied together, and they really should be combined. But as Jasmine said, there are now two trust funds. They're separate from the general fund, which operates the rest of the government. These are funds where the money is dedicated and can only be used to pay Social Security benefits and associated costs of administering those benefits.
Yes. So we want to move forward and talk specifically about the Social Security benefit, who it serves and how much it is, what people use it for, and how they get it. So let's start with Abigail. In general, how much is the average Social Security benefit?
Sure. So the average Social Security benefit for 2021 is about $1,500. And I think it's just important to note, especially during the COVID-19 crisis right now, that we've really managed to figure out exactly how much we can live on $1,500, or how much we can live on in a month's time, and definitely $1,500 is not enough. So, you know, to Jasmine's point, it's a very minimum amount, and the money that this money is used by older adults to be able to pay for rent, to be able to pay for groceries, to be able to pay for medicine, to be able to pay for transportation, to be to go to their doctor's appointments. So it is just a very minimal amount of money to be able to cover all the month's expenses, which I think you all can agree is not enough.
That's for sure. It's definitely not enough. $1,500 doesn't go far.
And just to add to that, I think that's exactly right. It's important to understand how important these benefits are. 2 out of 3 seniors rely on Social Security for most of their income. Mm-hmm. 1 out of 3 for virtually all of their income. And with people with disabilities, those percentages are even higher. So these are people on fixed incomes. They tend to have and they have lower incomes, as you can tell from those numbers, than the general population. But they are extremely valuable, especially to groups that have been, quite frankly, discriminated against in the workplace in the past. So that they're especially important to women, they're especially important to African Americans, to Hispanics, to other people of color, very, very important to the LGBTQ community, but they are really important for everyone. And it is why this program is so across the board. People really value this program.
And we sort of answered this question, I think, too, before, but I will go ahead and recap. The Social Security program serves 3 general types of people. So either you have retired and reached what we call old age, and you have left the workforce and now receive Social Security as part of your income. The other way is if you become disabled. So you haven't reached retirement age yet, but you become disabled while you're working. And then if you've earned enough credits, then you will receive disability benefits. And then the last way is if you lose a loved one, a spouse maybe, who was working in the workforce, and then once they pass away, you lose their income. So then Social Security steps in and provides benefits for the children, for the spouse in that situation. So there's, like I said, 3 main types of Social Security benefits: old age, survivors, and disability insurance. So the other thing we want to talk about is what Nancy began to talk about a little bit, is how the Social Security system serves different groups that have maybe previously been discriminated against or continue to be discriminated against. How does Social Security create a little more equity, a little more equality between those groups? Each of us actually represents one of them. So between women who often make less in the workforce, between Latinos, between African Americans who are often discriminated against, who maybe leave the workforce early for becoming disabled, or any any number of reasons. How does Social Security recover some of that? Nancy?
So, as I say, the program is wage insurance, and it insures against things you can't predict. So one thing that you can't predict is especially if you die at a young age, are you going to be a high earner? Are you going to have sufficient income, or are you going to have very low income? Now, you could have low income for a variety of reasons. You could start out as a high-paid lawyer, but get hit by a truck after working just for a few years, and then over your career, you will have averaged with the little bit you've earned over your whole career. You might have periods of unemployment where you over your career, you even though you might have had periods of high employment, you had periods of unemployment, and you might have been discriminated against in the workplace, either the gender gap or the gap because of discrimination in all kinds of things, and also also often people of color often they're the essential workers, which means that they're often in the most physically demanding jobs and can't continue to work for a long time. So Social Security, what insurance is, insurance redistributes. If you have fire insurance and your house never burns down, then you never get a penny. But if you have fire insurance and your house burns down and you get several $100,000 to replace your house, you didn't pay that in premiums. The idea is that you're pooling your risks. And so one of the risks, we're pooling risk of, for the life insurance piece, if you die prematurely, it's redistributed from people who live long lives to people who die prematurely, from people who are fortunate to not become disabled to people who are disabled. And there is a benefit formula that's weighted. So it's a little bit complicated, but the idea is that you get it's a very, very clever benefit formula, because the more you contribute and the more you earn, the higher your benefit in absolute terms. But the less you earn, the higher percentage you get replaced. So the idea is that people who earn $100,000 are able to save and don't need quite as much replaced as somebody who's making minimum wage. They may be spending all of their money on necessities, and so they need a higher percentage of that. Although the person making $100,000 will get, in absolute terms, a higher dollar amount. So that's what, again, going back to this point about savings versus insurance. Savings, you're on your own. Social Security and other insurance, we're all pooling our risks because none of us know what will happen to us in the future.
And Abigail, did you want to add about the communities that your organization serves and how Social Security helps them?
Yeah, so one of the things that I just did want to add as well is just how we earn Social Security credits. I think for me, it was very revealing once I realized how we earn Social Security as a whole. And it really is earning 4 credits a year for 10 years to be eligible for full Social Security benefits. And in 2021, you have to earn $1,470 for 1 credit. And I say this because this does make it a little bit harder for folks who are earning minimum wage. I did a quick math right now, and this means that for someone that earns minimum wage, they have to work 15 hours a week for the entire year to be able to get their full 4 credits. Now, for someone who who is a woman who might be working part-time and may have a child, it might be very difficult to be able to earn that money. So even though it seems that it's $1,400 is not a lot of money to be able to earn, for some it is. If you're a high income earner, this is nothing, right? This could be, you know, in your first month, your first 2 months of the year, you can achieve your full Social Security benefit for the year, or credit for the year. So I just think that's just really important for folks to know how they can earn their Social Security credit. But additionally to your question, Jasmine, the way that Social Security benefits the Latino community as a whole, I think it's just, at the end of the day, the way that it affects every American across the country. You know, it really helps those, especially women, who unfortunately, especially for people of color who, you know, who face discrimination, not just when they're young, but, you know, unfortunately it does follow them through their entire lifetime. For Latinas in the United States, the median amount that they get for a Social Security benefit at age of retirement is about $800. So it is slightly lower than what you know, the median amount is that we mentioned before was about $1,500. And so this really ensures that these women do have a little bit more access to be able to, again, pay their rent, pay their bills, pay their medicine, pay for their doctor's visits. But I know that we're going to get to this later in the program, but it's just another reason why we need to make sure that we expand these benefits for folks that do face discrimination throughout their lifetimes.
And actually, if I can add just to what Abby was saying, because I think that was excellent, all the points she made, that women are fortunate on average to live longer than men,
Yeah.
and Hispanics actually are fortunate to have longer life expectancies as well. Unlike savings, which you can outlive, you cannot outlive Social Security. It is there paying every month until you die. Now, by the same notion, because people, African Americans, Native Americans have shorter life expectancies, and we should be doing all kinds of things to rectify that. That's a part of the discrimination of less adequate health care, more dangerous working conditions, and so forth. But as a consequence of those, African Americans disproportionately benefit from the disability benefits because they're more likely to become disabled. So Social Security, again, is a program that works for everyone. It really is all of us, unity combined, working together as one nation. And also just to add to what Abby was saying earlier about immigration, you know, other than Native Americans, we are a nation of immigrants. We all immigrated here. Immigrants actually contribute substantially to Social Security because, as Abby was talking about in the Hispanic community, but it tends to be true of immigrants generally, they tend to be younger. So they are part of the workforce. They are contributing to Social Security over many, many years. And the actuaries have shown that immigrants really are a net plus to Social Security. If we increased immigration, we would spread the costs and reduce the costs for all the rest of us.
All right. So, Nancy, I want to go back to you actually to say something that you may have already started to imply, but I want to be a little more direct about it, is Social Security and modernization. We've heard quite often that Social Security needs to be modernized, maybe changed from its original intent. And in your opinion, does Social Security need to be modernized in any way?
Well, this is a often used by either people who really don't understand the program or people who are trying to undermine confidence and really change the program dramatically. And there usually goes along with, you know, we can't afford it, it's going bankrupt. Social Security, the basic concept underlying Social Security is thoroughly modern. As long as people are dependent on wages for their basic necessities, and that's true of virtually everyone in the United States, we need insurance against the loss of those wages. We can be unemployed, and although we don't generally think of unemployment insurance as part of Social Security, it was part of the Social Security Act of 1935. And we can become, as we've been discussing, we can become so disabled we can no longer work, we can die leaving dependents, and we can live to long life. And as I say, you can outlive savings, but not Social Security. There are certain ways that I think it should be expanded that you could think of. I don't think of it as modernizing. I think of it as just recognition of contributions. So one is to understand the role that immigrants play with Social Security. The other is the important, and for the economy more generally, and one is the important role that caregivers, which tend to be women but aren't always women, play not just for their families but the whole economy. That caregiving is very, we would not be able to sustain without family caregivers. And there is talk about providing caregiving credit, which is, there was actually some talk in the original bill about whether to give caregiving credit and so forth. There is, or split credits. There are spousal benefits, but there should be caregiving credits as well. But in terms of the basic question, the concept behind Social Security is thoroughly modern. We should be building on it and expanding it, certainly not transforming it from what it now is.
The last topic I want to cover in this first section of our Social Security 101 conversation is the Social Security Administration. We just talked about a ton of work. I mean, we're talking about benefits that cover millions of Americans. And so someone has to do all of the work to administer benefits, to make sure that when people need something and have questions, that they can be answered very quickly. And so we're lucky to have an agency like the Social Security Administration. And Nancy, I just want to clarify, who pays for that administration? Who pays for the services that we receive from the Social Security Administration?
We do. There are about 61,000 employees. There are about 1,200 field offices. Social Security is really the face of the government for many Americans. It's like the post office. It's there in our communities. And none of it comes from our general tax dollars or the general fund of the Treasury. All of it comes from these trust funds to which we contribute. In fact, Congress every year enacts an LAE, which stands for a limitation on administrative expenses. Social Security, we are talking about the trust funds. If you can believe it, there is a $2.9 trillion reserve. That's a surplus. We're used to hearing about all the deficits the federal government is running. Not with Social Security. It's a $2.9 trillion surplus. It spends about $12 billion of that surplus and the current income for Social Security. It should really be spending more. But don't let anyone talk, when you walk into those field offices or when you call, you should get immediate service. You have earned it, you have paid for it. We all pay for it through the contributions that are deducted from each of our paychecks, every pay period, matched dollar for dollar by our employers.
Well, this has been an amazing start to this conversation. And so I want to end this portion here. But in our next part, we will talk more about the threats to our Social Security system. Thank you for joining us.
Good morning, everyone. Thank you all so much for joining us today. I'm Jasmine Wigfall, the Legislative Director of Social Security Works. And today we're going to have an exciting conversation around immigration and Social Security. At Social Security Works, we work hand in hand with Latinos for Secure Retirement to not only strengthen, but also to protect and expand Social Security. Often in DC, Social Security and immigration are topics that don't get talked about at the same time, but they are so important and really work hand in hand, not just for the immigrant community, but also for the entire United States. All of us depend on immigration, we depend on immigrants, and we know that if we do really comprehensive immigration reform, our social security system will be strengthened for all of us. So I'm really excited about this conversation. I'm excited for you all to meet the panelists, because this is an important start to a conversation, again, that's not being had, but we need to have this conversation because there are members of Congress who are looking to start talking about immigration reform in a real way. There are also members of Congress who are thinking about passing expansion legislation related to Social Security. And so we need all of the partners, we need advocates, we need members of Congress, we need the White House, we need all of us coming together to talk about this important topic. And so again, I'm just thrilled that Latinos for Secure Retirement invited Social Security Works here today to be a part of this important conversation. Today, more than 50% of America's Hispanic population comprises younger generations whose imminent financial well-being puts them at a more significant disadvantage in preparing for retirement. Amidst the coronavirus pandemic, health and wealth disparities were exacerbated for communities of color, and especially for young millennials and Gen Zers who face employment insecurity and hardships due to the economic downturn. During this annual summit, we are focusing on the policy challenges and family commitments faced by young adults, with a key focus on the intersectionality of immigration reform and strengthening Social Security. And today, we're kicking off our summit with an action-oriented conversation with experts to understand the economic benefits of immigration reform as a vehicle for economic security, building a social safety net for older adults, and promising financial future for young adults. So again, I'm excited to introduce our panelists. I'm hoping that we will have a very exciting conversation. Today, we're joined by Eddie Tavares, and Eddie is the New York director of Forward US, and Edith Avila Olea, the policy manager at Illinois Coalition for Immigrant and Refugee Rights, also known as ICIRR. They're bringing us an update on the state of immigrants in Illinois and New York, respectively, setting the stage on how immigrant communities contribute to the economy, dismantling myths of immigrants and social programs, and sharing tools and resources to better understand how immigration reform will help solve the strains of retirement security. So we welcome you all to the event. We've come together today to engage our growing network and community to have a deeper conversation on protecting and improving the economic security of the young adults in our community, which ultimately reflects the financial well-being of the entire United States of America. So I'd like to bring Eddie and Edith into the conversation. Welcome to both of you. Thank you for joining today. I want to start with just allowing them to introduce themselves, introduce their organization, and then after that, we can get into a deeper conversation about the work that they're doing at their respective organizations. So Eddie, if you could please introduce yourself.
Yeah, thank you so much, Jasmine. Thank you for having me. So as you mentioned, Eddie Tavares, the New York State Immigration Director at Forward.us. We are a national and statewide bipartisan public policy organizations that really focuses on passing comprehensive immigration reform that is common sense, humane, and really goes into the root of dignifying immigrants' lives. And part of that comprehensive immigration reform is to ensure that we have a pathway to citizenship for the 11 million undocumented immigrants. And so, that's a passion of mine. My grandmother came here in the 70s. She was undocumented, separated from her family for quite some time, effects that I still see today. And so part of what brings me into this work is ensuring that no other family, or a person like my grandmother or my mom, who, unfortunately suffer some of those effects, are separated and are reunited, looking for a good opportunity. So thank you again for having me and looking forward to the chat.
And Edith?
Hello, everyone. My name's Edith Avila Olea. I am the policy manager at the Illinois Coalition for Immigrant and Refugee Rights. ICRR is dedicated to promoting the rights of immigrants and refugees to full and equal participation in the civic, cultural, social, and political life of our diverse society. In partnership with over 100 member organizations, we educate and organize immigrant and refugee communities to assert their rights, promote citizenship and civic participation, monitor and analyze and advocate on immigrant-related issues, and inform the general public about the contributions of immigrants and refugees. Much of what I focus on includes addressing the barriers that immigrants face when accessing health care and social services. Myself, I am an immigrant myself. I come from a mixed status families. And I moved up to the state of Illinois about 8 years ago to really focus on understanding where I can contribute, right, to some of the ongoing issues that immigrants have faced for decades at this point.
That's great. Thank you so much. So again, we are excited to begin the conversation with an overview of the state of immigrants in New York and Illinois to give a more local output to the contributions of immigrants to the economy. So Edith, why don't we start off with you, and then we'll go to Eddie for his remarks.
Okay, thank you so much. So I'm going to start off a little bit by giving a little bit of background on the public charge, because this has in particular really impacted many immigrant families around the country, but what we have seen specifically in the state. Just because I don't know if people understand the public charge rule or if they have a background on it, I'm just going to give a little bit of an overview to get us started. So what is the public charge? The public charge is defined as a person who is considered likely to become primarily dependent on the government for subsistence. In August of 2017, the Trump administration announced that they were going to publish a final public charge rule that would go into effect on October of 2018. As a result of the announcement, 9 lawsuits were filed across the country challenging the rule and ultimately delaying its implementation until February of 2020. The final rule was in effect on February 24th of 2020 until March 9th, 2021, when the Biden administration took steps to end Trump's final public charge rule. The public charge rule is reverted back to its original version of 1999, meaning that immigrant families can seek most public benefits without fear of being barred from getting status in the future. And so despite the fact that Trump's public charge rule is no longer in effect, we're still seeing the consequences of the public charge rule, often referred as the chilling effect. A recent study found a dramatic increase in immigrant families choosing not to enroll or disenrolling from programs like the Children's Health Insurance Program, often known as CHIP, Medicaid, and Medicaid, despite the fact that coverage for children and pregnant women was exempt from the public charge rule. Another study found that in 2019, 1 in 5 adults in immigrant families with children reported that they were avoiding using public benefits for fear of risking their future green card eligibility. And this rate was even higher among low-income immigrant families. What's most concerning is that what the chilling effect could mean for children. Another study released in April of this year, done in California by the UCLA Latino Policy and Politics Initiatives, underscores the vulnerability of non-green card holders and their children in California. They estimate that thousands of Latinx children could lose their source of care or forego care altogether. The number of Latinx children without usual care could increase from 64,000 to more than 180,000. And so it's really important that we continue to educate the community and the fact that many immigrants will not need to face the public charge guidance at all. There's no public charge test when an immigrant applies for U.S. citizenship, green card renewal, asylum, DACA, TPS, and many other categories. Also, most public benefits do not count for the public charge, including Medicaid, emergency Medicaid, the Children's Health Insurance Program, state and locally based healthcare programs, and other healthcare coverage, including subsidies for insurance purchased through the healthcare.gov and other healthcare exchanges, as well as the nutrition programs such as SNAP and the pandemic EBT, which has been rolled out since early 2020. I also wanted to speak a little bit about how immigrants, including DACA recipients, have contributed to the economy during the pandemic. So I'm kind of I wanted to give that background because that has really impacted how immigrants have perceived the use of public benefits. But it also will speak to how immigrants were even more impacted by the pandemic, which I'll touch on a little bit here. We recognize that the significant impact that immigrants have had in our communities, especially during the pandemic. Forward US published a study in December of 2020 showing that immigrants represent a substantial and critical part of America's essential COVID-19 workforce combating the pandemic. Nearly 23 million people, including medical, agricultural, food service, and other immigrant essential workers, make up 1 in 5 individuals in the total US essential workforce. This is about 5.2 million essential workers, of which nearly 1 million are dreamers or immigrants who entered the US as children. Many are DACA recipients, but also dreamers include those who might not necessarily qualify for DACA, the Deferred Action for Childhood Arrivals. More than 2/3 of all undocumented immigrant workers serve in the frontline jobs industries. Immigrant essential workers are indispensable and have proven to really carry us throughout this pandemic over 2020, and here we are in 2021. And the US continues to rely on them to fight the pandemic and contribute to a long-term recovery. This is one of the many reasons that ICER is fighting for immigrants who are essential workers to be included in immigration legislation. They deserve to be provided certainty over their future in the United States. And by doing so, we would recognize the critical work that millions of immigrant essential workers perform every day. And so I'm going to speak just a little bit about how immigrants have the impact that healthcare has had on immigrants, especially throughout the pandemic. But I first want to speak to a little bit of some wins that we've had, which have been very exciting for us. These wins really keep us going in the long term of this work. And last year, Illinois became the first state in the nation to provide a Medicaid-like program to immigrants 65 and older, regardless of their immigration status. And this year, we passed legislation that would expand the program to immigrants 55 and older. And this bill, SB 1840, is actually, it's a different one that I'm going to touch on in a second. But this particular bill is on its way to the governor's desk. So we are very, very excited about that. We also just passed legislation. This one is SB 1840 that will improve a hospital's charity care application process. So a hospital's financial assistance process to make it more accessible for uninsured and undocumented individuals. So while we celebrate these wins, there were hard-fought wins. We know that it's not the end goal, and we won't stop until everyone has access to quality and affordable healthcare coverage and equitable healthcare systems. Access to healthcare, is the means to pay for it affects the financial stability of individuals and families, the companies they do business with, and the companies that employ them. Access to medical insurance reduces both health and non-health related debt, enables consumers to spend more in their local economies, and increases workplace productivity and economic output. I'm going to give you just a couple of 4 clear economic benefits that can occur when immigrants have access to equitable healthcare. First, access to coverage and healthcare has a positive impact on financial well-being. Research shows that individuals residing in zip codes likely to be affected by Medicaid expansion experience reductions in collections and balances owed on both health and non-health related debt. State and local economies benefit when residents have access to affordable healthcare and coverage. The personal economic effects described above result in individuals and families having more disposable income to spend on goods and services. Workers who have access to insurance are more productive. Why? Because if they're sick, right, they're able to get off and they're not having to work, with that additional stress or the stress of a family member being sick. And health-related productivity losses are estimated to reduce economic output by up to 260,000 billion a year. The productivity losses are due to a combination of work days missed due to illness, workers' inability to concentrate because of, again, what I just mentioned, their own or a family's health condition, and reduce labor force participation among people whose health status prevents them from working. And I'll share a couple of the sources here at the end. But a stronger economy essentially benefits everyone. That's the reason why it's in everyone's interest to ensure that no one is excluded from access to health insurance or programs that make it more affordable. And some of the sources that I used include the National Immigrant Justice Center, Forward US, which we have a representative here, and a couple of others that I can send you the links so you can share those with the audience. Thank you.
Thank you so much, Edith. That was a lot of good information. And so hopefully our audience is just really soaking this all in, because again, these topics are all intertwined. Social Security work spends a lot of time working on healthcare, just like you do, Edith, because like I said, all of these topics, they all matter to a family, right? If you don't have good health care, then obviously you're not going to be able to take care of your body and make sure that you can be at work, and that impacts your retirement security. And all of those things are just really interrelated. And I hope that through your presentation, Edith, our audience is really understanding why we have to be so intentional about talking about all of these things at once. So now I kind of want to switch gears a little bit. We've seen what is happening we've heard what's happening in Illinois, all of the really great work that they're doing, investing in the immigrant community, even bills that are being signed right now. And so I want to turn it over to Eddie, who is doing really great work in New York and has a lot of insight into what we might need to know related specifically to the immigrant community there, and how we can take that and make it something maybe we can implement at a national level. So Eddie, I want to turn it over to you.
Yeah, thank you so much. I think when folks, envision New York, they usually do so from a very progressive utopia where everyone has access to everything. And for us, unfortunately, that's not the case. As it relates to immigration and immigrants, we've been, ever since I've been doing this work here, we've been really focused in bringing opportunities to immigrants, and particularly undocumented immigrants, via social economic opportunities and legislation, in addition to ensuring that families are not separated, and that we are protecting our communities from other forces that seek to do them harm. I'll start with a few successes that has occurred over the last couple of years. One of them is what we call the green light law, which is to ensure that undocumented immigrants have access to driver's license. This is an important step for us. Something that was previously accessible and available, but was taken out for us to really think about the not just social, but the economic impact that it has on people that live in areas where, it's not like New York City and has a public transportation that runs 24 hours. And particularly thinking of those folks that live in more rural areas that may have certain disabilities that may not allow them to walk or stand up in public transportation. So that was one of the big success that we had in 2019. Additionally, we've moved forward with several other legislations, such as the Protect Our Courts Act, to ensure that ICE wasn't interrupting our judicial justice system and going to separate families by someone either being a witness to or going to court. And so ensuring that without a judicial warrant, ICE could not go and target our community. This is something we saw happen and happen in very much alarming numbers at the beginning of the previous administration. And so we worked to ensure that New York was proactive about protecting all New Yorkers, regardless of status. And then this year, there was a very big win with the New York Heroes Act, which was a response of the pandemic that really has disproportionately hit marginalized community, and particularly undocumented immigrants. So this law will now ensure that under any kind of airborne disease, undocumented immigrants, immigrants in the gig sector, domestic workers across the state are protected, and employers are providing the appropriate life-saving PPEs to ensure that they can be safe, their families can be safe, and the greater community can be safe. There are a few other successes that occurs that our partners in the state worked on that I feel like I should be mentioning. There was one that they passed a fair labor law to ensure that farm workers were protected and had some labor protection in terms of overtime pay, a day off, disability, in addition to wage increases. And I thought this is important because a lot of the times agriculture workers and farm workers get left behind on very urban specific issues as it relates to undocumented immigrants, but also immigrants as a whole. Edith did a great job in mentioning their, how they've always been, but really were highlighted into essential workers in the work that they did, not just in New York, but across the country. So really highlighting that law that passed in 2019. The other one, which was a big win for undocumented immigrants in New York, is the Equitable Workers Fund. This is something partners in immigrant rights organization worked across the state to ensure that the undocumented immigrants that were left behind by the city, state, and federal government economic relief had an opportunity to receive it. And, clearly pending eligibility. But this is a huge step that they were able to secure $2.1 billion to go to underserved communities who are undocumented. We saw efforts across the nation and other great, organizers, undocumented people, and our organizations doing that work in other states. But in New York, we're very proud that, we were able to put that amount into ensuring that these community had some kind of relief that was substantial. And so, so that's sort of a bit of what the these successes in New York. I think we still have a long way to go in coming out of this economic regression, this pandemic, and clearly the issues prior to this whole healthcare crisis that we had. We want to make sure that there is healthcare accessibility and eligibility for undocumented immigrants and immigrants as a whole. We want to make sure that occupational licensing are part of that conversation to ensure that people have social economic mobility in the communities that they are. In addition to that, I think we want to make sure that we are being proactive about, and this is great to have this conversation about really thinking about the future and how we start to think as Latinos, how we start to think about retirement, and if that is something accessible, because that is another key point that we really don't talk about. Is yes, the educational aspect, but also the accessibility to retirement funds, and just even having enough money and income to put away some money. But very grateful to be part of this conversation, and looking forward to highlighting more things that we've done.
Those were all really great insights. And so we have some prepared questions, and we also want to hear from you. So please, please, please put your questions in the chat. If we don't get to them today, then we will continue to use those questions to design future programming. Again, the hashtag for this event, if you are tweeting along with us, if you are writing Facebook posts, if you are wherever you are on social media, the hashtag is Young Adults Retire. Please tweet along with us, ask your questions. Again, it will help us today, throughout this question and answer session, and again for future programming. So we talked a lot about the economy, the status of the economy, which is such a hot topic right now because we are getting back to what we're calling our normal, or what I call our new normal. We're all at home, so we're not quite back to normal. But I want to talk more about the financial struggle that immigrants face, specifically during a recession. We know that the COVID-19 pandemic was devastating for so many families, but for the immigrant community in particular, I know Edith mentioned, Eddie, I believe you mentioned as well, we know that immigrants are often frontline workers. They're often workers who are working in the agricultural field, people who are at risk for catching COVID-19. So could either one of you talk more about the financial struggle in either of your states? Edith, I can start with you to talk about financial struggle during the recession in particular.
Right. So I think I'm going to speak in light of the pandemic because I think we were able to pass some really crucial relief to aid immigrants here in Illinois. So as you all might know, right, undocumented immigrants and in the beginning, even mixed status families were left out of the pandemic relief, the aid that came from the federal government. And so we quickly pivoted, right, some of our work to address this injustice really at the state level. And we were able to pass we were able to get the governor to pass $20 million at the state level to aid immigrant families. And this year we were able to ask, we made a bigger ask, knowing, right, the devastation that immigrant families had throughout the state. And we were very, very excited to share that the governor included $44 million at the state level for immigrant assistance. And so we expect, right, that while this does not necessarily make up, right, for the loss or the exclusion that immigrants have had, not only during the pandemic year, but, we can speak about the exclusion of the earned income credit, right, both at the federal and state levels. So it doesn't necessarily make up, right, for the many ways that immigrants continue to get left out, but there is some assistance that we are continuously advocating for, right? And at the same time, we will continue to advocate for at least within the state level for the earned income credit expansion. That was something that we were fighting for this year. And though we did not get it, we won't stop, right? We'll continue that. We'll pick that up for the next legislative season as well.
And Eddie?
Yeah, we prior to the pandemic, we saw already the economic barriers that immigrants and undocumented immigrants were facing in New York State, I think this just exacerbated that something that, put not just people out of work, but literally took their lives, away from them in their livelihood. And you saw that sort of movement into the unknown. And so while the state did act, it was a lot of push and pull. And quite frankly, it's just not enough. Just because these are folks that, again, are usually lack the appropriate wages for a livable, life. And so this is something that's ongoing. Forward.us, we are committed to ensuring that we are continuing to seek ways legislatively to push for more pathways and avenues for folks to have more jobs and economic opportunities that lead to this variety of other positive factors on their health, stability, et cetera. But it's not enough. And until we find and have a comprehensive immigration reform and the ability and pathway for folks to adjust their status, we'll continue to have this issue at all levels of government, and I think across the country. And so I want to be clear that no matter how proactive a state, a city, a municipalities may be towards their immigrant community, undocumented folks are still in that limbo because of the inaction of Congress. And so there, of course, I can talk about days of things, the states can do, but that is the focal point of, like, if we want to fix something, then we need to really talk about what are the pathways, which, prior to, in the previous administration, but, the pathways were limited to, amounts that we've never seen before, where there was literally no way out. And even prior to that, under both Republican and Democratic administration, we have seen a targeting of that and a lack of option and creating additional ways and channels for folks to adjust their status. So I really want to focus on that area, because that is where a lot of the solution and opportunity can be given to the individual to really live their best fulfilled life. But unfortunately, we are having a Congress and a government that is more focused on the illegalization of an individual rather than the opportunity of that individual.
That is a wonderful point. I feel like I have several different things that I want to say, but I cannot say them all at once in response to what you just said. But the inaction of Congress is a problem in so many areas, and immigration reform is undoubtedly one of the major things that has become more and more and more polarized, when there was a time where Republicans and Democrats were ready to come together to do comprehensive immigration reform. And now we have just dealt with the entire Trump administration, their efforts to just undermine our entire immigration system, which is frankly un-American, right? Most of the people who live in the United States, their families were either immigrants or they are immigrants themselves. For my family, I will say we were forced immigrants, but yet and still none of us came here or were original here. I'll say most of us were not original to the United States. And so it is just unfathomable that we think for some reason there are people who are unworthy, who are undeserving of what we have here in the United States. And so that makes me want to segue a little bit to talk about myths. At Social Security Works, one of the myths that continues to come up over and over and over and over again in our work is that, and I won't say it how certain people say it, but the idea is that undocumented immigrants have access to Social Security. And so I will dispel that myth right now, very plainly and clearly for all of you. Undocumented immigrants invest a ton into our Social Security system, but yet do not have access to receive those benefits. And so there are wealthy people who are not paying their fair share into our Social Security system, and yet they receive benefits at full when they retire, or if they become disabled, or if they are a widowed spouse or a child. But again, undocumented immigrants do not have access to that system. So that's just one example of how our system could be reformed to make sure that we're including everyone and not just a few. I want to turn to talk about DACA, because we were talking about federal legislation. So DACA, if you all will remember, is the Deferred Action for Childhood Arrivals, which did allow a path for citizenship for a select group of now Americans. And that was put in jeopardy by the Trump administration, but thankfully has not gone away. But I would like to ask Eddie, since he brought it up, can you talk about why proposals like DACA, while they are smaller, are really important to young immigrants and how they make a difference in the lives of all Americans?
Yeah, so DACA recipients are still undocumented and only have a temporary status that they have to renew every 2 years at the mercy of the government. And so this is still a fact of limbo and uncertainty that DACA recipients currently live in every day, and can't really plan their lives out for less than 2 years, because you will have to renew prior to those 2 years. And so just to really focus on that aspect, that DACA is not a permanent solution. It was never meant to be, and continues to keep people, in the limbo. And so with that, the Trump administration, as you mentioned, Jasmine, tried to undertake and pull back the program. Currently, DACA is still on the thread. There is a federal court case in Texas, the Hanen case, as we some of us call it, where DACA, the actual standing of DACA is in question and is in jeopardy. And so this is why more than ever, a pathway to citizenship for not just DACA recipients, but also dreamers who weren't eligible to be part of that program for arbitrary reasons, need to be part of that, bipartisan legislation that had passed already the House, HR 6, American Dream and Promise Act. But thank you for really talking about how undocumented immigrants, such as DACA recipients, really contribute to Social Security, and yet they are not going to get any dime out of that amount of money that they're putting into the system as we speak. And so when we're looking at really an unfair and unjust, systems that we build, this is something that is intentional. The reason why I say is intentional is because we have had legislation put time and time and again, whether it's the Dream and Promise Act or the DREAM Act, several times for several decades, introduced. And yet, even with bipartisan support, we cannot get it done. Or I should say, Congress cannot get it done. And so, thinking about the great contribution that DACA recipients bring, not just in the, as essential workers, which a lot of us saw how they were in the front lines as healthcare professionals, educators, community organizers, and so on and so forth, in addition to not just the taxes. But I really want to talk about the morality of this and their humanity of people that currently have DACA or unfortunately were not eligible, and focus on what they mean to us. Some of us have DACA, some of us have family members with DACA, some of us have colleagues and friends that have DACA, and their contribution to society in that way. And that's what I really I want folks to really not just empathize, but really think about, is that these are not just people that are economic benefits, but these are people that are intertwined with who we are as individuals, because we interact with them, whether we know their, status or not. And so that to me is like the important aspect of this is, one, the failure of Congress, the limbo that it has left people, and the limitation that DACA has on people with, and that unfortunately could not get into the program.
And to Eddie's point about just to put some numbers to the conversation, if Donald Trump's immigration reforms, or well, I won't say reforms, if all of his ideas were implemented to cut immigration in half, to remove DACA, all of those things, Social Security would have lost $2.4 trillion over 75 years. In the reverse, if we actually did comprehensive immigration reform, then Social Security would gain $5 trillion over 75 years. So this, like you said, Eddie, isn't just about the immigrant community. This is about all of us. We are all benefiting from the work of the immigrant community. We will all thrive if we are doing the sorts of reforms that we're talking about here today. And so I want to bring Edith into the conversation because I know your organization works with people who have benefited from DACA. You work with Dreamers. And so if you could talk specifically about Illinois, about how people are benefiting from DACA.
Well, I don't think I had the opportunity to share this with you all in the preparation, but I am a DACA recipient. And I've been an original DACA recipient since 2012 when it started. And I couldn't agree more with some of the words that Eddie just shared. So thank you for uplifting, right, DACA recipients and not just the benefits that they bring, but I think just the fact that, right, we're a part of the American family ultimately. And so here locally, right, I think I want to point a couple of things out, that it's not just DACA recipients who contribute into not just Social Security, many other programs that, we don't necessarily qualify for because of the fact that, right, you need legal status for that. To receive these benefits, but it's also individuals who have an ITIN number, right? There are many thousands of families and individuals who do pay their taxes and who report their taxes annually, with an ITIN number and a federal tax ID number that's assigned to them if they apply for it. And also, I think DACA has unfortunately tokenized, what it means to be an immigrant, right? And that's not necessarily the case, right? You have to, DACA excludes a lot of people who, for one reason or another, maybe they had a past, right? Such as a criminal record, and therefore they're excluded. And essentially DACA is doubly punishing many people who do not qualify for the program. And so I think, as a DACA recipient and as, someone who works for an immigrant rights organization, we never saw DACA as a permanent solution. And it's simply because it's not, right. It's a costly program to keep it running. Many individuals who are from low-income families don't necessarily either have chosen not to apply for renew their DACA status because of the uncertainty of its future, as Eddie pointed out, but also because, as we saw with the previous administration, it's not necessarily a guarantee. And for many people, they are risking it all, especially if they come from a mixed status family when they apply or when they renew for their DACA application. And but as far as the contributions, I think specifically in the state, I already spoke to some of the numbers and the way that DACA recipients were a part of the essential workforce during the pandemic. But I also think that when we speak of immigrants, I think just culturally, we think of each other as not necessarily as an individual, but as a family unit, right? And so, unfortunately, I believe that DACA recipients have been used as upon, right? A trading unit maybe for many of our Congress members who for somehow are able to uplift DACA individuals, but then refuse to acknowledge the work of our parents and our grandparents who brought us here. And so I want to speak about, the contributions that immigrants have made as a whole to the state, and the fact that they kept us going during the pandemic. And I can speak right, to the fact that many of them worked in grocery stores. Immigrants are the ones who kept us fed throughout the pandemic, and who kept, many essential industries going. We can talk about farm life, but we can also talk about factories, right? My dad never stopped working, even though he did not have health insurance, right? Neither did my mom. They did not have the ability to work from home like I did, right? Throughout the pandemic. And many, many families can share a very similar experience, right? Where in reality, in a way, those who had more to risk because of age or crowded housing had less protection throughout the pandemic, and continue to have less protection, whether it's through, the fact that they don't get paid time off or sick days, right? Even, to take the vaccine. I personally, when I got the vaccine, I was sick after both shots, right? And I can only imagine what that fear or what it must have felt to have to work through that sickness, because you don't have the ability to take off. And also, I just want to point that immigrant families don't necessarily deserve legislation or a piece, a permanent solution to the current immigration crisis that the country has faced, because of the contributions that they make economically. I think immigrants contribute in more than in many more ways than that, and I think it speaks to the fact, right? If we look at the immigration history in this country, that by the mere fact of their existence and the life that they bring, not just through the economy, but also just through our culture and our food and our celebrations and our families, and the fact that we're all tied together, right? I think that's the true treasure that we bring to America. And so while I think that the immigration system tries to either recriminalize people, unfortunately, I think it's important to keep the criminal justice system separate from the immigration system, and not to punish people because of their history if they've already faced whatever their sentence was at that given moment. But I do believe, right, that as we move forward and we recognize the ways that immigrants have contributed to our local economies, I think that just like my family is looking forward to the possibility of something permanently happening, I think that's what many immigrant families would like to see. And I think it's difficult, right? I think maybe a reason that many immigrants haven't had the opportunity to think about retirement is because when you have all of these other uncertainties, retirement seems like something that's so far away, right? And how can you think about retirement when you're not necessarily sure if you're going to have a job, tomorrow, or food on the table, or rent to pay for? And so I think by taking care of each other today, right, we'll be able to take care of each other in the future and in the long run. But the truth is, right, that for many immigrant families, retirement seems like such a far off thing. I think we deal with families who are facing dire situations today because of the lack of healthcare coverage, or because of the lack of a status or employment protection. And I think that will be an ongoing conversations that younger generations will need to have with our older generations, right? Because ultimately, we're going to be the ones who are taking care of our parents if there's no permanent solution for them.
That was a better segue than you could have ever known, because I wanted to transition into talking about cross-generational solidarity. When we talk about Social Security at Social Security Works, we talk about it as a family program because often we're talking about its retirement benefits, but it also serves people who become disabled before they even reach their retirement age. It serves over 1 million children who have lost their parents for whatever reason. It serves widows, widowers. It serves just a lifetime of people. And so we think of this as something that it's not just about seniors, it's not just about young people, it's about everybody from what we say from cradle to grave. And so the same thing, the reason why we're talking about these topics together, right? Immigration reform and retirement security is because, again, they go hand in hand often because we, again, operate in families. I find, Edith, the same as you're saying, in Congress, often people are siloed into a category. They become almost a number, right? Oh, well, she is Hispanic and she is young and she is an immigrant and this is her box and we will do these reforms for her, right? Or somebody is in this box of being, well, she is Black and she is this and she is that, and we will do these reforms for her. In reality, we are all intermingled. It is important that we were talking about these things in conjunction. So, Eddie, I wanted to turn to you just to give your thoughts about why is it important for us to be in solidarity across generations. A lot of our audience is young, but again, you talked about your grandmother at the beginning of this, you talked about your mom. Why do we need to come together to have these conversations across generations?
Yeah, that's a great question. I think so. It's important. I would say from a personal perspective, my grandmother worked most of her life, and she doesn't have a retirement fund, right? And so she is getting older. She's in her 70s, and so and she is no longer working. And I know that whatever she gets from Social Security, it's just not enough. And so as a family, and particularly my family, as an immigrant family, we have to all figure that out together and chip in. Now, culturally, we are set up to do that automatically. But what does that mean as it relates to like the Americanized Western version? It means that we have less funds for different discretion, whether that's saving, whether that's other expenditure, emergencies that may come up, because we always have that. Same thing with my mother. She works as a bartender, doesn't have a retirement account. And she quite clearly also, and she says jokingly, quite clearly say, "You're my retirement fund," right? But the fact is that she has always been a low-wage worker, where that a retirement fund has not been available to her. Now, these are two folks, my grandmother being able to adjust her status and my mom being able to brought here in a family visa and has and is now a U.S. citizen. But these are folks that have documentation and have had documentation for most of their lives that they've been living in the United States. And so part of the solidarity is ensuring that we are doing everything to ensure that no one is being left behind in that generational, gaps that we go through. And one thing I do just also want to throw in and acknowledge is the Black immigrants that really suffer under such cruel system of both the immigration system, but also the criminal justice system that Edith had previously mentioned, and how those are the effects also that comes with the racism, but also anti-Blackness that lives within immigrant communities, but also outside of it, that we all adhere to and challenge and on a daily basis in the US. And so for me, solidarity is ensuring that we're having these conversations, but that we're proactively seeking opportunities and solutions for it to ensure that, as hopefully we fix certain aspects of our immigration system, whether that's providing legalization in terms of document towards people that are here, knowing that that doesn't fix the issue. That's part of a big problem that would help, but it doesn't necessarily fix the issue because we have a system that is created to go against certain marginalized community members. And so for that's the important aspect to me, is how do we find opportunities, how we can find the small wins until we get to, you know, the big one, which is comprehensive immigration reform, from my perspective.
That was a wonderful answer. I also want to add, because you brought up people who currently have a documented status, and I want to make sure people understand that, say you've been here your whole life, you are not exempt from being economically insecure during your retirement years. Social Security brings millions of seniors out of poverty every single year. And those are people who have worked their entire lives, worked 2 and 3 jobs, and still remain economically insecure. The average Social Security benefit, which I'm estimating, so don't quote me on this, but it's about $16,000 a year. So we're not talking about anyone getting rich off of Social Security. And for some people, that is their only form of retirement security. So please understand that whether you are undocumented and you're trying to save for your own retirement and you are depending on family members or just depending on yourself, or whether you're working in the workforce right now, there is so much risk involved in our retirement system right now because of the lack of action, again, by Congress to expand Social Security benefits, to make sure that everyone has access to this foundational system that was founded so that we can have security and not uncertainty and any time that we are permanently unable to work. And so, again, this is something that I think just crosses generations, it crosses class, race, gender, all of those things. And it's important for us to really talk through Social Security policy as well as immigration reform when we have this. I know we are running short on time, but Edith, I wanted to give you a chance to answer the same question about the importance of cross-generational conversations. Like, why are those things important for you and your own family, and then for other families as well?
Right, thank you. I'll be brief here. I think, you know, I agree with Eddie's points, right? You know, that in cases where, you know, because of the lack of opportunity, right, that my own parents had. My mom is a domestic worker. My dad has worked in factories of different sorts basically his entire life, and at times has had 2 and 3 jobs, especially in his early years as an immigrant. And I will just say that, right, you know, when you live in a mixed status family, you know, it doesn't matter if you have documentation or not, right? You know, at most times, right, people will act in the best interest to protect the undocumented person. We have seen, right, that, you know, with the public charge, for example, we have seen that families from mixed status families have also disenrolled from public benefits usage. And we have also seen that, you know, children who are US citizens and maybe have undocumented parents are then facing the consequences, right, of that lack of economic protection that immigrants have today. And so these consequences, obviously, if there's not a permanent solution, will cripple into, you know, my parents' old age and maybe even my own old age, because at this point, I'm not sure when we'll see that permanent solution. And I say it with a smile because I don't know what else to do, right, at this point, other than to hope that something will happen, even when it seems like the fight is really continuously an uphill battle. But I think just the way I grew up, right, in my Mexican culture is that I'm going to take care of my parents, right? And I think a lot of Latinx individuals have grown up with the same idea. And so I think, right, the best way that I can protect my parents is by protecting myself, and also making sure that I'm thinking of the future for them, because to be honest, they're in a position where they don't have the extra room in their income to think of the future in that way. And so as a good daughter, right, I will keep them in mind, and I'm going to try to do my best to put myself in a position where I'm able to do that. Because unfortunately, despite the fact that they've been in this country for 20 plus years at this point, almost 30 years, they still don't have any answers or promises of something that will help them in the near future. And while that's unfortunate, right, that's just I think the immigrants' reality, that it's never hand-me-downs, right? It's always been an ongoing battle for many, many families.
Thank you, Edith. So the last thing that we want to do is give out some marching orders for our audience, because we don't just have these conversations so that we can just talk back and forth. We have to do something. Again, I'm a legislative director, so I am all into advocacy. I want everyone to come to the Hill, come to Congress, go see your state reps, do whatever you have to do to really move forward the things that we're talking about. Because if we just start this conversation and it results in nothing, then we haven't done anything except have a conversation. So, Eddie, I want to turn to you first to highlight any of the things that you think our audience here today should be aware of, that they should know about, that they should be able to take action on, and then also let them know how to be in touch with your organization if they want to learn more about the work that you all are doing.
Yeah, thank you for the opportunity. I would say this: there are several bipartisan bills that are on the table, whether that is for Dreamers, TPS recipients, DACA recipients, farm workers, or essential workers. And one of the important factors is to really email your Congress member and or U.S. Senator to really tell them your story and why you're supporting it and why this is important to you, your neighbors, your family members, etc. And while it seems like something that everyone tells people to do, it is actually quite effective when they get the volume of it and they get the consistency of it. So if you're able to, please go ahead and do that. One of the ways so we're a public policy organization. So one of the ways to get connected is, visiting our website, which is fwd.us, or following us on social media channels. We do a lot of, great reports we put out there every so often. We also elevate a lot of the directly impacted people that are leading the movement and lead our organization and guide us to do better work and be better. And so you can follow us there. We also do have this other entity called Inform Immigrant, or inmigranteinformado.com. It's essentially a hub for immigrant information, anywhere from how to apply for DACA, TPS, public charge, etc. We partner with a bunch of national and local organizations to give out resources, anything from Know Your Rights, etc. And so I recommend folks to go into it, look at it, give us your feedback, and spread it around so that folks are empowered to use that as a tool, and also know what their right is. But yeah, that's all.
Great. And Edith?
Thank you so much for the opportunity and for having me here today. It's been such a pleasure to be able to share a little bit about my own journey and also about the good work that ICRR is doing in the state of Illinois. So I think my ask will be for individuals to contact their federal representatives and senators, and to ask them, to write or ask or call or visit any of the above at this point, right? And ask them to pass legislation that is inclusive, right? That does not exclude one member or the other. And also specifically to ask for legislation that does not include criminal exclusions for individuals who've had a criminal record. Most of the legislation pieces put out recently, exclude individuals who've already paid for whatever it was that they did in the past. And I just, if we take a restorative approach and the fact that we all deserve second chances. And so, ICRR is taking that stance, right? That we do not want immigration systems to be coupled with the criminal justice system. Let them be separate systems, and urge the senators, right, and representatives to get to come to the table today, because they should have come to the table yesterday.
So true. And since I'm here, I also want to give everyone the opportunity to learn more about the work that we're doing at Social Security Works, learn more about the expansion legislation that, again, we think would do the work to help really build on what Social Security is now and shore up retirement security for everyone in our country. So our website is socialsecurityworks.org. We have lists of legislation, we have lots of communications tools, things that you can, petitions you can sign, fact sheets and things that you can take to your member of Congress or their staff as you're having conversations, and highlighting the importance of pairing these two topics together again, immigration reform and making sure that our retirement security is intact is just so important, and again, goes hand in hand. We all need each other. It sounds cheesy, right? But we do. We all need each other. We all depend on each other. We live in a community. We live in families. And so it's, again, important to make sure that when we're talking to our representatives, that they are having that they have a strong understanding of why we can talk about these things in conjunction. And then I also want to encourage organizations that if your organization is only focused on one of these things, being in solidarity with other organizations, whether it's your expertise or not, is also important. We work primarily on Social Security, but again, we love to partner with Latinos for Secure Retirement because they have expertise that we don't have. And being able to stand in solidarity together is so much stronger than doing things apart. So again, we have to close, and we're sorry if we didn't get to your question, but again, continue to ask them in the chat, continue to tweet again at Young Adults Retire, because we will continue to use all of the things that you all are communicating with us in future programming. I want to thank the panelists so much for sharing their experience. I feel like I learned a lot today. We welcome all of you in the audience to continue this conversation about the intersectionality of immigration reform and strengthening Social Security with your colleagues, with your friends, and with members of your family, to get them invested in this and to really understand about why it's so important for all of us. Community building did not stop during the pandemic. And as our country starts to open up, we're bringing this conversation with resources and direct actions everyone can support. And while retirement, immigration, or Social Security issues may be the last thing on people's minds, it's our duty to inform our community about legislative updates, ensure that young people are getting equitable access to economic relief, and to be a guiding force as they are met with financial difficulties for the second time in a generation. If you didn't RSVP to this event, please visit our website, latinoretirement.org, or sign up for our newsletter to receive your invitation to these and more educational conversations to increase planning and savings, retirement readiness, and economic awareness. Thank you to our partners and everyone watching. Stay with us as we welcome our next speakers with more insights on how immigrants contribute to this country and how you can help ensure this and future generations retire with dignity. Thank you.
everybody. My name is Yosima Reyes. I'm a poet and I'm a writer. And we're going to be starting off with one of my poems. Mi abuela is 85 years old. And since we began social distancing, abuela's distraction has been spent in our living room watching telenovelas y las noticias. I spent my day stuck in my room, pressured by writing deadlines and Zoom calls. I try to break down to her how I can still work through the computer and what a Zoom call is, but it goes over her head, so she leaves me alone for a couple of hours until she comes barging in the room reminding me, "No has comido en todo el día." We sit down to eat, and through conversation, she explained to me the latest updates with COVID-19. Abuela doesn't understand that through social media, I'm already aware of these updates. Univision gives her tips on how to disinfect the house, precautions she should warn us about when running essential errands. She knows that she's high risk, being that she's 85, so she's very attentive to what the news informs her. Trump announced a stimulus check of $1,200 given to every American. Excitedly, she asked, "¿Y nosotros? ¿Nos van a dar?" I have to explain to her that undocumented people who file taxes with an ITIN number do not qualify. She shows concern for her comadres because she knows they aren't as lucky as her. She knows she has me, and with my English, I've been essential in helping navigate resources for her. She also heard that Governor Newsom in California announced an eviction moratorium. ¿Y qué es eviction? I explained to her that this means landlords cannot evict people for not being able to pay the rent. But it does not make sense, because even if you're not able to pay, your rent will accumulate, and you will need to pay back rent. For many undocumented people who live paycheck to paycheck, this will create a system in which they will be indebted to landlords. No es justo. Si nosotros trabajamos. Abuela is aware that during this pandemic, undocumented labor is the backbone that is holding America together. These essential workers are the same ones we've seen go viral for being asked to speak English while providing customer service. These are the workers so many opposed to making a living wage with the excuse, if they wanted to make more money, they should have gone to school. As if education did not equal student loans and was a guarantee of making a living wage in this country. These are also the farm workers we essentialize when wanting to prove that brown hens picked your salad. Abuela's comadres are like her, non-traditional workers. They are street vendors, recycle bottles and cans, work cleaning hotel rooms, nannies, or go door to door selling Mary Kay products. She calls them, and when they have questions, she hands me the phone so I can explain to them the resources provided locally. Las señoras are grateful for my intelligence, and before hanging up say, "Gracias a Dios que te llamé." Thank God I called you. In the same regard, Abuela has placed the uncertainty of this moment in prayer. She sits with the giant print Bible in her lap, and with her magnifying glass, she reads scriptures. During this quarantine, she has vowed to read the Bible cover to cover. She says her faith is the sole reason she has been able to survive this country, and I believe her. It takes a divine power, unearthly energy to be undocumented in America. While the rhetoric in this country is that we are the invisible enemy, Abuela and her comadres built networks of support for one another. Through phone calls, texts, and WhatsApp messages, they check in on each other. While the Trump administration weaponizes these moments to vilify us, we prepare for the next battle that lies ahead. The invisible enemy, a group of señoras praying for the fate of the undocumented. So the video that you just watched is titled What About Us? Y Nosotros qué? And that video was actually shot on March when the pandemic was starting. And one of the things that happened is that at the time I was living in Los Angeles and I was commuting back and forth between LA and Eastside San Jose, California, where my grandmother resides. And one of the things that I started seeing is the way that COVID had impacted my neighbors and my community. In San Jose specifically, there was 3 zip codes that were disproportionately impacted. Those zip codes happened to be zip codes that were heavily populated by Latinos, heavily populated by immigrants, heavily populated by undocumented immigrants. So in that video, more than anything, I wanted really to capture community care and the way in which as community we step up and we take care of each other, despite, there is this misconception that as undocumented immigrants, we steal resources or that we take advantage of the system, when the reality is that we are living in the margins and oftentimes we have to rely on each other in order to make it. So I really wanted to showcase the care between me and my grandma, but more than that, me, my grandma, y sus vecinas, las señoras around my neighborhood. So we shot that video. The video happened to go viral, and one of the beautiful things that happened through that poem was that I was actually able to partner up with Siren, a nonprofit organization that provides services to immigrants in San Jose, and collectively I was able to raise $17,000 and provide aid for 26 undocumented mujeres. So I think for me that, if anything, that's what my work is about, right? As a poet and as a writer, I realize the significance, and what motivates and drives my poetry is the people on the ground that inspire it. So yeah, that's one of my proudest moments. I'm definitely proud that we were able to do that and capture that in a video. I mean, yeah, for me, the biggest one, and I think for all of us, right, when COVID began, it was announced that so many of our elders were the ones that were being tested positive, and suddenly, we're collectively grieving the loss of our abuelitos, abuelitas, or tios, or tias, who happen to be older. And for me, that was the most scary thing, right? Knowing that my grandma is living in the small apartment, and is surrounded by a lot of people because we live in these kind of neighborhoods. And for me, it's like, how can I make sure that she's safe? And also knowing that mi abuelita is in and out, she's a hustler, she likes being out, and to tell her that you cannot go outside is something that was very, very difficult. So for me, the biggest thing is getting my grandma to safety and making sure that she is as safe as possible. And then from then on, it's really kind of seeing the disconnect, right? The fact that oftentimes as Latinos, as immigrants, we do not have the privilege to stay home, right? There was this huge debate about whether to stay home. And for us, most of our familia chose, work over safety, because the reality is that we still have to pay rent and the bills are still accumulating, and the rent is not canceled. So for me, it was kind of witnessing that really opened up my eyes that, wow, I need to step up and figure out a way that, one, I think for me, I've always grown with the idea that I'm the translator in my family. So I'm always finding resources. So I think for me, how do I extend that invitation to my vecinos and provide resources to them? So I think for me, it's I didn't even really have time to really take care of myself, because I was more concerned that, my neighbors are getting their basic needs met. And thankfully, now we're coming out of that. So I'm really grateful for that. Yeah, I think one of the things that happened, I've always been kind of financially responsible for my grandma. She's 86 years old, and I've always but look, the thing about my abuelita, that she's a movida, right? She's one of those viejitas that is nonstop. She's always been hustling. She sells Mary Kay. She's one of these ladies that loves a good pyramid scheme, honey. She's out here selling todo, ¿verdad? And that's one of the beautiful things, because it gives her purpose, and she likes working, and she likes having her own money. And of course, she doesn't have to do it. But, I've always been financially responsible for my grandmother. But I think with this instant, one of the biggest things was realizing she can't do that no more, right? She's not agile. She might get hurt. She might fall. She might get lost or forget a street, or like, so she cannot be on her own anymore. So I think that was the biggest paradigm shift that I did, of like choosing to move back with my family, was that I'm leaving my career in LA, moving home and reinventing whatever I'm doing so I can work from home and I can still manage to take her on her walks or exercise, make sure that she takes her medication, and more than just her medication, make sure that her emotional needs are met, right? Because our grandparents are so bored, and they don't have anything buddy to hang out with. So you have to pivot and do that. One of the things that worked for me in taking care of myself was definitely trying to find the balance with other family members that, listen, I need to take a weekend off and I just need to go unplug, go exercise, go run, go read, or even throughout the day, right? I have to remind my grandma about boundaries. Like, I just need an hour of my day to myself so I can enjoy my food or hang out, and then if you have a question, we can pick it up later. So I think for me, it's like creating those kind of boundaries, para que no estemos, because the one of the things that happens specifically with Latino families and immigrants is that we're very codependent, and codependency means that if I do something, it's going to affect the emotional well-being of my grandmother, and likewise. So for me, that's one of the things that I'm trying to be very aware of not buying into that codependency, because obviously my grandma's happiness is her happiness and I am my own, right? So I think for me, like, that balance and those boundaries have been very important. Having meals with my friends, checking in with them, because I think caregiving is a lot. It takes a lot of energy, and I sometimes I get burned out, and then it's not good because obviously I don't want to be snappy with my 86-year-old abuelita. And if I'm in public and I get snappy with her, it looks really bad. So I'd rather like enjoy the moment. But honestly, the other thing, it's not a burden to me. Honestly, that's the other thing that my grandma often says, like, siento que soy una carga, or siento que, that I'm a burden. I'm like, no, you're not a burden. Like, it's one of the biggest blessings to be able to take care of you. It's one of my biggest honors to be able to remind you that you're worth, that your days of stuff, we're undocumented and immigrants. So she's always talking about how much she suffers. But I'm like, no, I want your legacy to be joyful. I want the rest of your life to be abundant. Si quieres algo, I want to be able to be like, yes, you can buy it. Yes, we can do that, right? And I think that's been my biggest mission in life right now, is like, how to become full circle from the poverty we came from to now living in a life of abundance, in a life where we're like genuinely laughing and allowing ourselves to feel joy. So yeah, that's my mission right now. So I feel like I'm accomplishing it right now. So yeah. Yeah, one of the biggest things is budgeting. I think one of the things within my own finances, I already had a good budget within living my own expenses and my grandmother's expenses. But I think one of the biggest things was, yeah, like that. One for me was very important. In that video, you saw the neighborhood that we kind of lived in. And obviously we lived in that neighborhood since we arrived to this country in 1991. We've outgrown it. It's definitely not where we're at right now. Thankfully, as a poet and as a writer, I am blessed that I can make a living out of my art. And my biggest thing is like, how do I get my family out of this neighborhood? And I, not necessarily because I don't want to live with my neighbors, but also because of safety, right? We're getting so accustomed to live in these neighborhoods that oftentimes, the housing conditions are deplorable. We in Silicon Valley, rents are super high. But I was like, listen, I need to also believe in myself that wherever I moved, I need to have a space that can also allow my family to get out of poverty. Is a class thing, but it's also mental. So I want my family to imagine themselves out of that neighborhood and imagine themselves living in a place where there is peace, where it's quiet, where we're not surrounded by whatever chaos, and move. So for me, that was one of the biggest things. I got to get my family out of the neighborhood, because then we can focus our emotional needs. Thankfully, now we live in a way better place. And the other thing, balance between my family. I think I realized that I had to be very direct in my communication conversation with my brother, with my siblings of like, listen, my grandma is 85 and we got to do anything to protect her. So I definitely need some sort of assistance. I think that's the hardest part also when you are a caregiver. How do you ask for help? How do you ask for assistance from everybody else? If my grandma has a medical bill and I can't meet it, I'm like, okay, we got to pitch in right now because she's your grandma. So we got to do this. So I think that's the other thing of asking for help. And then in my own personal finances, thankfully through COVID, we couldn't go out anywhere. So I think that allowed me to definitely save a lot more. You know, I didn't have to buy clothes because I'm always in my pajamas. So I think that allowed me to kind of scale back. And then moving back means that I don't have to pay my grandma's rent and my rent. Now I have a better budget because now, you know, we all live in the same place. So things like that I'm very aware of. And now, you know, I definitely budget my grandma's expenses into my monthly bill, whether that be doctor's visits, medication, and her own, you know, I have to give her an allowance so she can be happy. So, you know, she's satisfied with the money I give her so she can go to the store and buy groceries or whatever she needs. So yeah, you know, one of the things, there's this book called The Undocumented Americans by Carla Cornejo y Villavicencio. She is one of the first undocumented writers to be nominated for a National Book Award. And in that book, she says that the twisted inversion of immigrant kids is that inevitably we will become our parents' caretakers. We will become our parents' caretakers in a country that never wanted them. And we are gonna be, our mission is to kind of, you know, help them live with dignity. Our parents, you know, oftentimes don't think about retirement. That's why your dad is still limping to the construction site, right? Because no piensan in their health in that way. Their thought to this country is like, we came to work, no matter what, it's to work. And we have the mentality that we're going to save everything. Y cuando nos regresemos a nuestras tierras, that's where we're going to spend it, which is, it's very ironic. But I think my message is that I think as immigrant kids or first generation that take care of parents, oftentimes you're going to go through that like envy of other people that don't have, this is not their calling, right? Like sometimes it's going to feel like, I want to go. I know that for me, I can't catch a plane and go live in New York and follow my wildest dreams because I know that I'm responsible for this person, right? But I think oftentimes we got to be careful of not feeling that jealousy, but really honoring the moment that you exist in, right? Because now I realize, well, actually, I don't have to do that because I have a bigger message here, and a bigger responsibility here. So I think the biggest thing for me is like, yeah, don't feel, it's okay to feel like, oh, this is a task that I don't want to have. But at the end of the day, really look at the whole picture. And you're going to realize there's a deeper meaning and a deeper lesson in honoring the legacy and the sacrifices that your parents made to have you here. And ultimately, I feel like it's definitely, for me, it's an honor. I learn lessons from my abuelita every day. Sometimes we get into it, that we ask forgiveness, but over there, at the end of the day, it's definitely something definitely that I enjoy. So yeah, look at it as a gift. Yeah, so my name is Yosimar Reyes. You can find my information on my website, yosimar.com, YOSIMAR.com. If you want to meet my abuelita, she's on my Instagram videos all the time. So you can feel free to follow me on Instagram at Yosirey, YOSIREY. Yeah, and should I be of any resource or help, yeah, if you feel to reach out to me, I'm pretty accessible. So muchas gracias for having me.
Hi, everyone. I'm Anna Kent, a senior researcher at the Institute for Economic Equity at the St. Louis Federal Reserve Bank. And today I'm going to be talking to you about Latino wealth and retirement wealth specifically, and how that has changed since the COVID-19 recession. So the work that I'm going to be presenting to you today represents my own views and not necessarily those of the Fed or the Federal Reserve System. So first, I want to talk about just overall wealth inequality, just to help set the stage a little bit. So this data comes from the Survey of Consumer Finances in 2019, which is the most recent data that we have available and in this data set, and it's really the gold standard in terms of wealth data in the United States. So what we see here is we have basically a money pie. This is the total family wealth in the United States. And the top 10% of families ranked by wealth, about 13 million families, they owned in 2019 76% of that total wealth pie. Now, the bottom half of American families, about 64 million families, own just a 1% sliver of the pie. And this has grown since the data goes back through 1989, and this has grown tremendously. So what we really see here is increase in wealth inequality. And importantly, these types of gaps, who is in the top 10%, who is in the bottom 50%, it's not just randomly assigned. So for example, Hispanic families and Black families are much more likely to be in that bottom 50th percentile than are white families proportionally. And here are just some other statistics to set a stage. So for Hispanic families, only 3% of them are millionaires versus 15% of white families. About 12% of Hispanic families are in debt, meaning that they have more liabilities or more debt than they have assets, versus 8% of white families. And while many people believe that getting a college degree is key to success and really equalizes the playing field, our research shows that that is not necessarily the case. Racial wealth gaps, ethnic wealth gaps certainly remain at higher levels of education. Hispanic families with at most a bachelor's degree have less wealth than the typical white family who just has a terminal high school degree. And so what this really illustrates is the magnitude of the racial wealth gap and the pervasiveness of it as well. So again, I mentioned that the data set that we most typically use goes back to 1989, and the most recent data that we have is from 2019. So what this figure shows is what median wealth right at the middle for Hispanic and white families has looked like over this 30-year period. So the top blue line, that would be the white median, or for wealth for the typical white family. And we can see that it has grown, and with the Great Recession, it took quite a large hit, but has recovered since then and stands at $184,000. Now, the Hispanic median, on the other hand, has increased quite a bit, more than tripled since 1989, but the gap still remains very outsized, very large, and to the point where in 2019, Hispanic families had just 21 cents in median wealth for every dollar of white family wealth. Now, the dots in the middle of the graph, those blue dots, represent the percent of Hispanic families that have less wealth than the typical white family. So in other words, in 2019, the typical white family again had $184,000, and 76% of Hispanic families had less than this. Again, the median represents the 50th percentile, so 50% of white families had more, 50% of white families had less. And yet a much larger share of Hispanic families had less than this. And this percentage has remained fairly consistent over the past 30 years, again, illustrating just the magnitude of that ethnic wealth gap. The bottom number to the right here represents retirement savings and defined contribution plans. Only about a third of Hispanic families had retirement savings in these types of plans, whereas over half of white families did. So within this asset category of retirement, there remains a gap as well. If you look at other asset categories, such as home ownership, for example, we see also that there are gaps between Hispanic and white families. Now, if we turn to younger Latinos, we might be wondering how they are faring. So some recent work from the Institute has come out with these estimates, which looks at Hispanic, white, and Black families relative to their same race, ethnicity peers over time, different generations. And what we see is that millennials across the board are below where we would expect them to be relative to their same race, older generations. But Hispanic families lag farther behind than do white families, and Black families staggeringly far behind both Hispanic and white millennials. These are older millennials born in the 1980s. And this doesn't even address racial and ethnic wealth gaps among this older millennial generation. Once we do that, we see, again, very, very large gaps. So the typical Hispanic millennial family had about $22,000 in wealth in 2019 versus $88,000 in wealth for the typical white millennial family. And that's a gap of about 25 cents per dollar. And if we turn to retirement savings and what that looks like, we can see that there are gaps as well, notably racial gaps more than generational gaps. So if we look, whether it's at boomers, Gen Xers, millennials, we see that whites consistently have, are more likely to have retirement savings and defined contribution plans. And of those families that have retirement savings, they have greater balances as well. And that's the bottom figure there. And those kinds of gaps remain consistent across generations. So for example, for white millennials, they have about 60% of them have some sort of defined contribution savings versus only about 32% of Hispanic millennials. If we turn to what those actual values represent, we see that for white millennials, it's about $24,000. For Hispanic millennials, it stands at about 15. So again, if we look at specific parts of the balance sheet, if we look at specific assets like retirement savings, we see that there are very large, racial and ethnic gaps. And this was back in 2019 at the height of a 10-year record-long economic expansion. So we might be wondering what happened since COVID-19 when we know minority families, women, et cetera, were very hard hit by the pandemic and the recession. So the types of industries, as you likely know, that were harder hit in April 2020 were leisure and hospitality, other services, things like personal and laundry services. Leisure and hospitality had an astronomical unemployment rate of nearly 40%. And Hispanic women disproportionately hold these types of service sector jobs, with 29% of Hispanic women in February of 2020 employed in these types of positions. And so they were really disproportionately hit, which obviously has an effect on not just the woman, but the entire family. And then just generally speaking, low wealth groups that I talked about before, again, back the data in 2019 that we had, those are the same ones, younger families, Hispanic families, Black families, those that were less educated women that experienced disproportionate job loss with the COVID-19 recession. So how are they doing as of the most recent data that we have? Well, we see here the unemployment rate for Hispanic or Latinos, as well as for whites. And the unemployment rate for Hispanics and Latinos especially remains elevated. So out of all the racial and ethnic groups, Hispanics had the highest unemployment rate as soon as the pandemic, the recession, began in about April of 2020. And that has certainly gotten better, but it remains elevated relative to where it was before the recession began. So currently, as of the most recent data, May 2021 stands at about 7.3%. And you can see that there's a pretty stable gap between Hispanic or Latinos and whites. But unemployment rates don't tell the whole story. So unemployment rates just look at the share of people that are actively looking for employment in the past month or so versus the labor force participation rate, which talks about people that are actually in the labor force. And so what we see here is that the labor force participation rate remains muted. So in February, of 2020, for Hispanics, it was pretty high. It was 68%. And it's about 3 percentage points lower as of May 2021 than it was prior to the recession. And so we still see that there is recovery, and that recovery has it seemed kind of flatlined for both Hispanics and whites. So there remains a lot of concern along this measure. So finally, I just want to touch on, again, what younger generations, what younger Hispanic and white generation look like here. So the most recent data that we have from a different data set, the Survey of Household Economics and Decision Making, is from November of 2020. And so this is right in the middle of the recession, and we can see how it's been affecting their finances. So what we see here is that Hispanic millennials and Gen Z lumped together, only about 39% of them would handle a $400 emergency expense, a relatively small cash expense with cash or its equivalent, versus about 64% of younger whites. And this is important because having a cash buffer on hand has been associated with being able to weather economic storms like the one that many of us recently experienced. So the fact that most Hispanic young people do not have this kind of cash on hand is very concerning. In addition, only 18% of Hispanic millennials and Gen Zers say that their retirement savings plan is on track versus 36%, or about double, white millennials and Gen Zers. So both of these figures are actually fairly low, right? And of course, these generations are still very young. Many Gen Zers haven't even reached adulthood yet. But that being said, it's important to take advantage of compound interest, as I'll get into in the next slide, and really make sure that we're saving as early as we possibly can. So just to summarize, one thing in terms of wealth, you'll notice that I wasn't able to give updated wealth numbers since the COVID recession. The reason for that is, again, the wealth data that we have is most recently from 2019. However, there is another data set where we can look at average wealth as opposed to typical wealth. But average wealth really talks about a family that is better off, just because of how wealth is skewed in this country, with a very small amount of people holding a large share of the wealth. So average wealth is really going to be talking about well-off or rich families. And what we see there is that on average, across the spectrum, Blacks, whites, Hispanics, they're all doing really well with record highs in terms of average wealth. But that's misleading because that average wealth isn't representative of the typical American family. So that's just something to keep in mind if you're reading stories about average wealth being at all-time highs, or the recovery being very strong for a lot of people. We're leaving out in those types of statistics a vast part of our society. So another thing to recall from this presentation is just that those that were most negatively impacted by the COVID-19 recession were those with the fewest economic resources to weather the storm initially. Again, that's problematic and frustrating, but really means that we need to center these groups, Hispanics, young families, in the recovery efforts, and not only center them, but center their voices as well, so that we are actually targeting the needs that would help them the most. Summarizing again, the Hispanic white wealth gap for older millennials, those born in the 1980s, most recently that gap stands at about 25 cents per dollar, which is fairly comparable to what it is in the overall Hispanic white population, 21 cents per dollar. In terms of solutions and what we can do moving forward, I think there are a lot of things that have come to the surface from COVID. Some of them are racial and ethnic gaps, but also the things that we can do to maybe ameliorate some of those gaps. For example, investing in care infrastructure. So not only are Hispanic and Black women disproportionately represented in the care industry, but they're also more likely to be single, for Black women, especially single mothers, and the primary or sole breadwinners of their families. So investing on both sides of the care industry is important for them, as well as having family-friendly work policies and benefits. So Blacks and Hispanics, BIPOC people are more likely to be in low income positions that lack benefits that really help along the wealth building ladder. And so if employers start providing those types of benefits, paid family leave, paid medical leave, then we can move the needle forward on closing the racial and ethnic wealth gaps. And I think one area that a lot of people can get around and get behind is children. So there's been a lot of talk recently about baby bonds, child savings, or child development accounts through platforms like 529s, which target education. And again, it takes advantage of compound interest. So if we conceive these universally, meaning for all kids, either at birth or very young ages, and then progressively, so that children of less wealthy families get more starter seed money to begin with, then we can really make a difference, not just in the racial and ethnic wealth gaps, but generational wealth gaps, educational wealth gaps, gender wealth gaps as well. So I think these are critical things that, again, many people can get behind. And an interesting one that you may not know about is a similar idea, but instead of for education, it's for retirement. And a colleague of mine, Ray Bashar, proposed this years ago, and it's starting to get some traction again, 401 kids. So it's a similar idea where you're able to start retirement accounts either at birth or at very young ages, and then build that wealth, take advantage, and have larger retirement balances when you need them. In terms of what you can do now, again, take advantage of that compound interest, invest in yourself now, even if it's small money that you put aside. You'd be surprised at the amount that you can come up with later if you just take advantage and are able to put some money aside now, as well as making sure you have, if possible, an emergency fund for a rainy day, which again has been shown to be a very important indicator of financial stability. So with that, I will wrap up my presentation, but my contact information is here if you have any questions or would like to reach out. Thank you.
Hi, I'm Jasmine Wigfall, Legislative Director of Social Security Works, and welcome back for part 3 of our Social Security 101 lesson. We're joined again by Nancy Altman, the president and the co-founder of Social Security Works, and Abigail Zapote, who is the president and CEO of Latinos for Secure Retirement. Thank you, ladies, for joining us for this last session of our Social Security 101. So to start, we're going to talk about Social Security expansion. Social Security expansion is the main work that we do here at Social Security Works. We believe that Social Security is strong, that we have to protect those benefits, that they should be strengthened and expanded. And so we're going to delve into what that means exactly, because some people are unclear when we say we want to expand benefits. So first, I want to turn to Abigail so that she can tell us exactly what Social Security expansion entails.
Yeah, thank you so much, Jasmine. And it's great to continue, talking about this issue, especially about expansion. If you guys remember in the earlier session, I mentioned that the median amount of money that folks receive for Social Security benefits is about $1,500, which on its own, it's not enough. And so when we talk about expansion, we talk about an overall increase of benefits for everybody. This means that this will affect you, it'll affect your grandparents, it'll affect your family if they ever become a Social Security beneficiary. And additionally, it's also to be able to include different groups that might have been excluded previously, or to give additional benefits to folks that, again, might be excluded. We'll delve a little bit more into all of the different expansion benefits that we would like to see in upcoming legislation. But overall, this would be a benefit increase to anybody that would be a Social Security beneficiary.
So we see an increase of money, or we could see an increase of services as well.
Mm-hmm.
So benefit expansions cover so many different things, and we want to talk a little more specific about what those different proposals are. We saw, like Nancy has mentioned earlier, that we have President Biden and Vice President Harris, who are both very supportive of several different Social Security expansions. There are so many proposals in both the House of Representatives and the Senate that would expand Social Security benefits and services. And so I want to have Nancy start by talking us through a couple of those proposals because she's written about them extensively and is really an expert in this part of Social Security. So to start, why don't we talk through maybe what I think of as the most popular Social Security expansion proposals, which are the Social Security 2100 Act and the Social Security Expansion Act, which are introduced in both the House and Senate. And so, Nancy, can you talk us through those a bit?
Absolutely. And again, thank you for having Abby and me again for this session. And just to build and sort of put in context and then go into the specifics, what Abby was saying, it's important to understand that Social Security is a solution. You hear a lot of those who try to undermine confidence in Social Security to talk about it as if it were a problem, but it's not. It is, as I said in an earlier session, it is strikingly superior to every other form of retirement income that we either have or could really imagine. It really works well. It works extremely well. It works efficiently. It's extremely secure. It's extremely fair in its distribution. Its one shortcoming is that its benefits are too low. They are inadequately low. They need to be expanded. We're facing a looming retirement income crisis where too many workers will not be able to retire and maintain their standards of living in retirement. So as Abby said, there are proposals to expand the level of benefits. There are also additional protections, the other situations where people can lose their income and need that income replaced, such as sick leave, or if you take time out of the workforce for to take care of family members, or if you have the birth or adoption of a child, to have parental leave. So all of those are ways that Social Security can be expanded. The leading proposals among as Jasmine mentioned, the 2100 Act, which is a leading proposal in the House of Representatives with 208 co-sponsors in the last Congress. The Social Security Expansion Bill, which was really a who's who of everyone who ran for president on the Democratic side, were co-sponsors of that. And of course, now President and Vice President Biden and Harris have ran on a platform of expanding Social Security. There are across the board expansions. The 2100 Act gives everyone about a 3% increase in Social Security. There are various ways to structure those increases, but an across the board increase. Those Congress last increased those benefits in 1972, so it's been a long time to do that. There are also another expansion that affects everyone, although I don't think of it as an expansion, more of an update, is the cost of living adjustment. Every year, one of the big benefits of Social Security is that benefits don't erode as a result of inflation. There's an inflation adjustment every January. It was put in the law in 1972. At that time, there was only one adjustment that the Bureau of Labor Statistics produced. It was called the CPIW. It was the cost of living of workers. But seniors and people with disabilities have higher healthcare costs, where costs are rising disproportionately fast. They tend not to buy the latest smartphones and other gadgets, where there tend to be better and better products at reduced costs. So their inflation rate is quite different. And all of these proposals are to update the benefit. So it's called the CPIE. It's a cost of living adjustment tailored for the elderly. Another is a minimum benefit. There has been from the beginning a minimum benefit for Social Security beneficiaries, but it's really eroded over time, and it needs to be updated. And all three, the Biden proposal, the Larson proposal, and the expansion bill in the Senate, so the House. So there's a lot of overlap. There are other targeted expansions. There are proposals for improved widowed benefits, improved benefits for grandchildren caring for their grandchildren were able to get benefits for those grandchildren. There are caregiver credits so that when you take time out of the workforce, you don't, you lose cash compensation, you also lose credit towards Social Security. And the idea is to allow people to get that credit towards their Social Security benefits. So those are some of the kind of targeted increases and the leading ones that I believe the Democrats all favor, and that in advocating, it's something that it's important to get on the, have an open vote in Congress, because I think that if it were voted on, the Republican constituents would want it too, and there'd be pressure on Republicans. In fact, one that is an issue in all districts is a technical provision called REP GPO. It's a provision that affects primarily state and local workers. It affects firefighters, it affects police, it affects large numbers of public school teachers. So it doesn't affect everyone, but the ones that it affects very substantially. And President Biden has proposed eliminating, getting rid of that reduction in their benefits, and that would expand their benefits. So all of those are ones that are really popular among all Americans across the ideological spectrum. The donors class doesn't like it because they are generally the ones that should be paying more for it, and because of the income inequality to which Social Security is another solution. So when people are advocating for it, it's important to let Republicans know that their constituents really, the polling shows, want these increases too.
Yeah, and one thing you began to talk about was the donor class and people who are more wealthy, who may not want to pay for these sorts of benefit expansions. But when we talk about expanding Social Security, we're talking about people paying their fair share into the program so that they can benefit too. So people who are wealthy are not guaranteed to be wealthy their entire life. Anything could happen with the stock market, anything could happen with your wealth, and you could have health problems. You could have all of these things that take away your regular source of income, and Social Security is there for you, whether you're wealthy or whether you're very low income. And so, people,
Joe,
go ahead.
And interrupt you on that point, because I think that's such an important point. There is one story that I've never met the man, but I read about it. It was in the New York Times, the Washington Post. A man named Neil Friedman, who lived in Florida, he was a multimillionaire, was retired in Florida with his wife. They had traveled around the world, had a wonderful life. They made one serious mistake. They put all of their money, they had Bernie Madoff invest all their money. The younger people, they may not remember this, but Bernie Madoff was finally arrested. He had a Ponzi scheme. He lost billions and billions of dollars, and he wiped the Friedmans out, and they became dependent on Social Security. So even if you're already receiving, you're in your 70s and you think you're set for life, you make one bad mistake like that, you make a poor investment, or you get defrauded out of your money, you could wind up like Mr. Friedman. So thankful that he had Social Security, because that's all he has now.
Yeah, and just for reference for our trainees, the employees and employers pay a portion of your Social Security, and there is a percentage, which I'm sure Abigail and Nancy both know very well, 6.2% of our income is put into Social Security. Our employer also pays an additional 6.2% of our income, of the percentage of what it would be for our income, into Social Security. And that's what makes up we talked about FICA earlier. That's what puts money into the trust funds and pays for Social Security benefits. So the other thing
I could add as well, Jasmine.
Oh, please, go ahead.
One of the things that I think folks should keep in mind as well is that for folks that are working, for phone-based apps, whether that's Lyft, whether that's food delivery, etc. Those folks are treated as independent contractors, which means that they are paying not only the employee side but also the employer side. And I think that that's just important to note, because I think as we're doing advocacy as well, it's also making sure that companies that treat folks as independent contractors also pay that employer side, because they are utilizing that employee, and a lot of these folks use these phone-based apps as their primary source of income. And so I think that that might be a little beyond this conversation, but I think it is something to keep in mind, because especially during the pandemic, this has been a source of income for a lot of communities across the country.
I think that's a really important point. And the other point is that the money is deducted from paychecks all year long. You pay that 6.2%, but you pay it up to a maximum ceiling. It was $137,700 in 2020. It's gone up a little bit to, I think it's $142,000, a little bit more than that in 2021. But most workers, 96% or 94% of the workforce makes under that maximum. So a lot of people don't even know that it's there. They pay every paycheck for 52 weeks, and the year in, year out. But for the very wealthy, they stop contributing to Social Security after they hit that maximum ceiling. So we joke that it's really not a joke that Bill Gates probably stops contributing by his coffee break on January 1. Members of Congress stop paying in the spring. A lot of wealthy, the very wealthiest stop paying. And one of the leading proposals to require to fully fund Social Security, and as Jasmine says, to require the wealthiest to pay their fair share, is to require everyone to pay all year long, just the way minimum wage workers do, average wage workers do, the gig economy workers that Abby was talking about. Everyone contributes, but the wealthy should contribute at least the same proportion, if not more, than everyone else pays.
One other expansion that's really important that we could do, which is really just a restoration of what used to be, is the student benefit. So Abigail, could you talk a little more about how the student benefit has changed and how we could make it better?
Yeah, so back in 1981, there was a Social Security reform there as well. But one of the things that ended up happening through those negotiations and through those conversations is actually ending the benefits to children of retired, deceased, or disabled people to receive a benefit up to the age of 22. What happened through those conversations is that apparently in the 80s, college was more accessible than it is today now. Obviously, we know that college is very, very expensive now. And so through those conversations, they said, well, college is very affordable and very accessible to folks. We're just going to bring down the age for those beneficiaries to the age of 19 or when they graduate high school. Now we know, as I mentioned, that college is very, very expensive. And so being able to restore those benefits for students who come from families who have disabled members, deceased parents, etc., would be just another great restoration to ensure that students from vulnerable families also have the same or also have the accessibility to be able to go to college without another challenge being put in front of them.
And if I can add to what Abby said,
Please.
That the idea of Social Security is that, and it's the idea of insurance, that all of us are standing in the place of a parent. Parents generally, if they're able to, try to assist their children to get higher education. And it doesn't have to be college or university. It could be vocational training, but some post-secondary education, which is so important in today's world. So what Social Security is, all of us standing in the place of that parent who is now no longer with us because of death or because of disability and can no longer work. One of the reforms that some in Congress are talking about is increasing the age not just to 22 but to age 26, because of the understanding that often today, because of the expense of college, it often takes people more than 4 years to complete their post-secondary education. And just one anecdote, I have a colleague who lost, the family, the parent died, and one of the children went through school before 1981 and was able to get those benefits and got a college education. The other sibling, who was born and reached college age after 1981, when the benefit was no longer there, never went to college. Now, you can't know in any particular situation whether that person would or wouldn't have gone to that college, but it does mean a lot to families, and it really does help people who've had the tragedy of a parent who's been lost, for all of us as a community to step in and help those children survive, really flourish.
Yeah, and we started talking about this earlier in our lesson 1 session, that these benefits are going to be even more important as we continue to work through this pandemic. People have lost both of their parents during the pandemic. It's been absolutely devastating to families, and so student benefits and expanding other forms of Social Security is going to be so important throughout this pandemic. We haven't, and it hasn't ended yet, and so there will be more loss, and we will need it more. Go ahead, Nancy.
Absolutely. I think what the pandemic and the economic collapse has shown is, again, Social Security is a solution. How important it is. There are, as Jasmine, you said, there are, at the time of this taping, over 400,000 people who have died in this country from COVID. They're now saying there's going to be another 100,000 by mid-February. And many of these people are leaving dependents. There are the so-called long haulers who, even when they don't die and they seem to recover, still have lingering fatigue and other things that make work impossible for them. They may wind up needing the disability insurance benefits. There are many seniors who wanted to work longer and earn higher Social Security benefits, but either they lost their jobs and can't get them back, or it's just not safe for them to return to work, and they had no other income, so claimed early retirement benefits. For all these reasons, Social Security is going to be more important, and expanding it will be more important.
Yeah. The last program that I wanted to cover is actually one related to Social Security, very closely, but not exactly part of the Social Security program. It's called Supplemental Security Income. SSI, as we call it, is for the lowest income members of our society, and it's really, really, really important to so many Social Security beneficiaries. So Nancy, I was hoping that you could explain a little bit why it is that we fight for SSI alongside Social Security.
Absolutely. I mean, the idea, and this is part of the idea of increasing the minimum benefit in Social Security, that after a lifetime of work, people should not retire into poverty. But more generally, we're the wealthiest nation in the world at the wealthiest moment in our history, even though it doesn't feel like that to a lot of people because of the income inequality and the way wealth has been distributed. But the idea that we have seniors and people with disabilities, and in fact, anyone among us, children, who must, with seniors, decide between, are they going to eat that day, or are they going to take their medicine, or have to cut their medicine in half, or worried about getting thrown out of their homes and becoming homeless. So back in 1972, Congress decided that as a companion to Social Security, for the very lowest income seniors and people with disabilities, we would have a minimal benefit for people to ensure that, again, that they were not below poverty. They were not destined to be impoverished. Unfortunately, there's a very strict assets test and income test. And unfortunately, Congress, it has been decades and decades since Congress has increased that program. And it has really eroded. You can have almost virtually no income and no resources to be eligible for Social Security, for SSI. There are dual eligibles, people who get Social Security and SSI because they became disabled and their benefits were low. So in addition to expanding Social Security, it is crucial that we expand Supplemental Security Income, SSI program. It is just a moral imperative. Again, we are so wealthy and we all are a community, and we should make sure that Social Security is strong, and for those who have fallen through the cracks, SSI is there to catch them.
Yeah.
And I would actually like to add just a quick anecdote as well. I mentioned previously that I had a family member who is on SSI, and unfortunately, this is one of these programs because of means testing. It keeps these folks in poverty for the rest of their life if they want to continue to utilize this program. My cousin got in a terrible car accident when he was about 10 years old. Thankfully, they were able to, they had a lawsuit. They were able to give his family some money, but because he was under SSI, he ended up, and his family ended up with an invoice for $10,000, which was how much money he ended up getting from the lawsuit, and that money had to go back into the government. And so, I think as we're thinking about solutions for folks that are, eligible for these programs, we should be thinking about, could he have been eligible to put that money into savings so that he could have money for college, or, to be able to make his life better. And so I think that this may be, an issue to be talked about further, but just in the ways that means testing, is to the detriment to some of these families that are eligible for these programs.
Oh, and I think Abby is making such an important point. So much, and this is true actually with Social Security as well as SSI. The people who created the program really saw it as benefits that people were should have as a matter of right, that they were eligible for, that they had earned. And unfortunately, in the last 10 or 20 years, there have been conservatives, elites who, the old joke about being born on third base and thinking they hit triples, that they are very privileged, but they don't recognize their privilege, and they tend to be very mean-spirited. And I mean, that is ridiculous that the government would claw back that money when it should be going to the child who was injured in the automobile accident. And there are all kinds of rules through the SSI program that are just punitive. They're just mean-spirited. If you bring groceries, if Abby were to provide groceries for that family member, that would get deducted from his SSI. I mean, what kind of a country would penalize and discourage families from caring for each other? So part of expanding these programs is to get rid of these really mean-spirited rules and recognize that everyone, including people with disabilities, want to work, they want to be productive, but it's just not always. People get in car accidents, things happen to people, they get struck with illness, and through no fault of their own, they just cannot survive. And all of us should be compassionate and helping, because, but for the grace of God, go each of us.
So true. And there is a bill called the SSI Restoration Act that would make sure that SSI is improved and made better so that families can make themselves save. For example, they would be allowed to save, I'll say, So there's so many different proposals, and we keep good track of them. So if you're ever wondering, well, what's been introduced in Congress and what kind of things can I fight for, you can always visit socialsecurityworks.org/legislation and find all of the different bills and proposals that Social Security Works endorses. So the other important thing to talk about is Congress. So we have good proposals, but obviously the landscape of actually passing these through Congress and them making it to the president's desk changes from year to year. We are in the 117th Congress, and there are very thin majorities or slim majorities with the Democrats in both the House, and very, very, very slim, meaning that only one vote in the Senate allows the Democrats to have a majority. And so, Abigail, I want to talk a little about what that means for Social Security expansion legislation. Do you think that there's any chance at all that we could see any of these proposals moved forward in Congress?
So I think they will, and I have a lot of hope. I think especially as we look at this Congress and that this new administration, that thankfully, we do have, even if it is a slight majority in the Senate, I think that the legislative solutions that we support, that we hope that you're advocating for as well, are seen by not only Democrats but Republicans as well, especially at a dire time in our country, in a time where economic security is at the lowest that we have seen it, in our lifetimes. And I would even say that, especially as generations that we saw the economic recession in 2008, and now we're seeing this, other economic recession, that this should be a priority for all legislators to see the economy rise again, to see people employed again, to see people wanting to continue to have that economic security that I think really makes us into the wealthiest country as a whole, and the wealthiest, and that should mean that we all have the opportunity to not only achieve what our described American dream is, but at the end of the day, to see our communities thrive. And so I do think that I have a lot of hope. And if we don't do it within these next 2 years, I think it'll be a lot harder to make it within the next congressional session. So I hope that you are encouraged with this information that you're given today by Social Security Works, by us at Latinos for a Secure Retirement, to ensure that you're doing your best in your own capacity to ensure that we do get these legislations passed.
And if I can just add that, I mean, Abby and I are exactly in agreement on this, that we even though we have the House and the Senate, the Democrats have the House and the Senate by very slim majorities, they also have the White House, and they're all in agreement on what should be done. And importantly, the American people agree with them on what should be done across the ideological spectrum. So what that means is that if President Biden decides to champion Social Security, and we urge him to do so, and we believe he will do so, we already have a champion. The House is ready to act. They had hearings in the last Congress and were poised to act, but just knew that they couldn't get it through the Senate and signed into law. But now they can definitely get it signed into law. And because they control the gavel in the Senate, they can hold hearings in the Senate as well as in the House and bring it up on the floor. And if the Republicans block it, then they should have to pay in 2022. Or else, if they want to go forward, then there can be a nice signing ceremony that we all should feel we can attend, at least virtually. But it will be all of us that helped achieve it, and all the people who are taking this SOAR training and really urging their members to move forward on Social Security expansion legislation, expand with no cuts.
Oh yeah, very important. I completely agree. I too think that we could see expansion legislation in this Congress. So I'm excited for all of our trainees to see all of this information so that they can be fighting with us and alongside us and pushing these things forward. So the last thing that I want to ask is kind of a general question. But what kind of advice do you have for our trainees moving forward as they're advocating for these things? So Nancy, can you start?
Sure. The nice thing about this issue is that, as I say, as polarized as the American people are over many issues, and there are many hot button issues where you're going to get in fights with people, Social Security is not one of them. People understand how important it is, that it's going to be more important than ever. They want to see it maintained, and they would love to see it expanded. So that, and everybody understands, whether you're conservative or liberal, that this is a benefit that you've earned. It's like earning your paycheck. So I think the idea is to talk to friends and neighbors, try to recruit others to go with you when you address your members of Congress. And as I said in an earlier session, because today the opponents of Social Security are not forthright, and they all say they love Social Security, but it's going bankrupt. You cannot allow them to have just got away with platitudes, saying, "Well, of course I agree with you. We've got to, we love Social Security. We're just not sure that we don't want to have a huge tax increase," or whatever it is they say. You really have to hold their feet to the fire and ask them, do they support expanding it with no cuts? Are they open to cutting it? And push them accordingly and let them know that you will remember this and you will be voting in the next election.
Yeah, and Abigail?
Sure. I think first and foremost, currently, I would say that advocacy almost becomes a little bit easier because you don't have to fly to DC to be able to have your voice heard. You can always call your member of Congress. You can always email your legislator as well. But I think it's also important that when you are talking to them, or when you're even talking to a staffer, to bring your life experience into that conversation. Social Security is a program that covers all intergenerational families, whether you're a grandparent, whether you're a working member, whether you have children, this affects you. And once they hear those personal stories of how you're affected, and especially during this pandemic, it definitely is a strong force to be reckoned with. Additionally, as you're making, your rounds, whether it's a phone call or whether it's an email, always ensure that you are also letting your legislators know that you do not concede to any cuts to Social Security, whether that is privatization, whether that's raising the retirement age, whether that is, whether they're saying, well, we prefer this legislation rather than this legislation. If you hear anybody saying anything about benefit cuts, you stand your ground and you say, no, I am completely against that. These are benefits. They would be benefit cuts, and that is not something that would help Americans across the country. So I think that with the information that you're given today, with your voice, it is going to be so powerful to make sure that we move this legislation forward and that we protect Americans across the country.
Yeah, I love that. And I really don't have anything to add to what either of you said, because you covered it so well. I think our trainees understand and know that their voices matter a lot in this fight, that they're called to their member of Congress, their email, and later we'll learn about tweets to members of Congress. Those things matter, and they will make a change. It doesn't take that many people to make a difference on Capitol Hill. And so I hope that all of the trainees feel encouraged and really motivated to go out and make a difference after this training.
Hi, I'm Lorena Silva Edwards. I work for the Borderland Rainbow Center. I am their Youth and Senior Services Coordinator. At the Borderland Rainbow Center, we are the area's only LGBTQ community center. we're working to get together with all of the community organizations that are local in El Paso, Texas, here in the borderland, to work together to reach our seniors as well as the entire age group, for our LGBTQ allies as well as our community. Some of the services that we provide at the Borderland Rainbow Center are we provide therapy on a sliding scale to our community, as well as support groups that are absolutely free in a variety of topics, from transgender support and support to their family members, as well as a Stonewall AA meeting, all the way to teen groups. So we do have a multiple layer approach to our community to provide support to them for anything that they need. We also offer community events, such as open closet community, where we can bring in clothing and do clothing drives for various needs within our community, such as a career closet when people are looking for new jobs. If they don't have the clothing they need for that, they can come to us for that. We also offer back to school community closet. So if our families have children, or even college age students who are going back to school, or even adults who are going back to school, they can come in for that. And then also our transgender community closet. So if they are in mid-transition, they can choose to leave clothes and also get clothes. We also offer a food pantry that services the community, about 200 to 300 families a week that we help in this time of need right now, in order to help them get by with the pandemic. And then obviously the job situation right now is very difficult here in the borderland. So we choose to reach out to everybody. And this is not just limited to the LGBTQ community, it's our entire community can come and get a hold of us for those things. As you mentioned, a lot of them have unwelcoming family members or situations at home that are hostile or unsafe. So they do have to find a community network that is not just supportive for them, but also healthy for them. So we do our best, and at the BRC, we are a substance-free location where they can come and get together and not just network, but find family and these healthy relationships and support systems that are going to help them in the future. Often they say, that the scene for the LGBTQ young people in particular is only bars and what have you. So the BRC wanted to provide a location, and that it was spawned from the need of that. They found a community need for a location that didn't involve any kind of substances whatsoever. That was just a nice, safe place for them to come together, be with family, offer family, right? Offer their support for other people who may also be in different stages of coming out or living out. For all of their community. We find that our community is very, very close-knit, and they do support each other when given the opportunity and the safe space to do that. We also make it a big point to educate our community on the various benefits that they have to them. So often one of the biggest barriers for Latinos and seniors here in the border, whether LGBTQ or not, is having access to the various programs that are available to them. They're so used to not necessarily understanding that there's a network of information just providing them benefits that they didn't know that they had access to. And so they're dealing with that. It's kind of like an untrust. That's the way I'm going to word it right now, especially in the border area where they've militarized the border itself and made everything very aggressive and very unwelcoming. It's not a very positive experience for them to want to even seek help, because there's multiple layers, right, of things that can be holding them back, whether it's that maybe they haven't had access to the education that they've needed, or there's financial barriers, or even there's mixed status as far as, their citizen status that makes them fearful. It makes them fearful to come forward to ask for help. They don't, there's a fear of putting their undocumented relatives in danger by accessing any public services. We want to definitely put, a stop to that and let them know what is available for them to help them get ahead here, to help them basically thrive. We enjoy empowering all of our community in order to let them not just help themselves, but also change their legacy. There's a huge, huge disconnect between the generational ability to not just take care of yourself, but also leave something for your families. And that's something that has plagued the Latinos, the Latino LGBTQ demographic for quite some time. And so that is one of the things that we want to help educate, right? Knowledge is power. So we want to help educate our community to let them know and empower them what's available out there, what they have access to, have them share by word of mouth also to their community in order to help them help themselves, help the community, help their further generations, their children, and, as well as helping to take care of seniors that they also take care of, because we know the millennials and the Gen Zers are right now taking care of grandparents or parents as well to help their families out. That's a great question. And the Borderland Rainbow Center definitely prides itself on making sure that there is accurate representation of our community. So that starts with us, our board, as well as our entire team at the Borderland Rainbow Center is very diverse. We have an incredibly diverse staff that represents our local area. So, often they have conversations about how there's a room full of people who don't represent the people that they're making decisions about making these decisions. And left on the outside is that demographic, that group that has their lives being controlled by a group of other people who have no idea what they're going through. So the Borderland Rainbow Center makes sure that we constantly have a diverse representation, accurate representation of the LGBTQ community within our board as well as within our staff. And that includes people of color, it includes people of varying financial status, varying ethnicities. It's important to us as well who we partner with. For example, when we do like our cafecitos, for instance, when we work with the NCOA and the LSR, we make sure that all of our advertising accurately represents the people that we are trying to reach, because it doesn't make any sense to have a very, what they would call very whitewashed, right, representation of what we're trying to get across when people can't see that and accurately relate to it. I know that when I'm trying to get, if I was trying to get my grandparents involved with these discussions, then I'm not going to show them pictures of people that they don't feel like they can relate to. So even what is seemingly the smallest things, such as media, we always work with people who will reject any kind of a media that is not going to be accurately representative of who we serve in our community. So that's one of the biggest things there. But then, as I said, also making sure our board is diverse so that we're not having people who don't understand the walk of this life, making decisions for the people who are walking this life. Yeah, the Cafecito was a game changer for our senior outreach, as well as for the outreach for their caregivers. Because as I mentioned, right, the millennials, the Gen Zers, these are the ones that are also helping to take care of the baby booming generation. But the Cafecito was able to reach them in an area that was easy enough for seniors to access very easily via a Facebook link or just a Zoom link. There wasn't a lot of heavy engagement that was technical, and that can be a huge barrier, right? Especially with a demographic that we're trying to reach. So making it simple for them to watch, just as simple as, looking at the TV, just looking at a program that's on TV. That's how simple we made it for them to be able to come and join this conversation. Locally here in the borderland, what also was a huge draw was finding someone who was local, and that was our Congresswoman, Veronica Escobar, because that is somebody who is local, it's local to the area, and has become a huge success, right? Is out there advocating for our city and being able to show them that, again, as I was saying, show them representation of our area, of our communities. Here's someone who is just like us, who went out and is advocating out there for us at a national level. And then being able to bring it, our partners in Texas as well, in Austin and Dallas, having everybody close by, right? But still showing how far apart we are, because Texas is a huge state. Being able to show them the things that are available, not just to them, not just in El Paso, but also in the entire United States, was able to bring them, kind of elevate them to a level where they can see that although we do live in a small city, we're not trapped here. We're not trapped in this small city. We have the same opportunity to kind of look out there and see what's available to us to try to, as you said, let's talk about retirement, because this isn't something that, it's not the same. It's not the same level for our Latino and our LGBTQ community as it is in other parts of the United States. So being able to give them the tools and see that the tools are there, make them tangible, make them reachable for them, relatable, because we're all here, we're all talking together and making it on a level that they can easily understand. As you mentioned, that benefits checkup tool is just amazing. We use it constantly here at the BRC with our seniors. We also do just paper flyers that can go out in our food pantry bags to our seniors, and that brings it to a level where they can just very simply scan it with their phone and access it. We also help them by going out into the community with our tablets and helping them fill them out. And then we can print up a nice, huge, thick layer of papers that shows them what they qualify for. And that kind of supersedes that technology barrier that we have. But I mean, really, it's the Cafecito, huge game changer. That really, really brought in the seniors into from our community into reaching out to us and asking for assistance. And that's what it's all about, was just reaching them. Well, my message is that we have the opportunity. None of us expected this pandemic. None of us expected to be grounded at home, right, for over a year. But there's no mistake in saying that there was definitely issues before we went, right, on the pandemic, before we were all grounded and sent home. There was still issues back then, reaching out to our community and helping them as a community to get ahead, to even just make it. Now that we've had this year and a half at home and we've had to become innovative and come up with new ideas on how to reach each other and how to still stay in touch and take care of our loved ones, our abuelitas, our tias, and not just that, but also helping our children who are, just now getting into the workforce. Now that we've had to come up with those ideas, we have the opportunity now to make changes when we go back into the workplace and incorporate all of those things that we developed while we were stuck at home trying to reach out. We were taking that for granted. We took that for advantage. We took advantage of it, rather, when we were all in an office together and we could very simply just, reach out to whoever. Now, I think if we go back into the offices, we're going back into the workplace, getting the kiddos back into school. We're starting to see that glimmer of hope again. We have the opportunity now at this point, right, to come together and incorporate the things that we've learned during the pandemic and become innovative with the ideas that we had to come back into the workforce and make it amazing. There's no reason for us to go back and make it the way it was. That is unacceptable. We need to try harder to come together and use the new ideas to reach out, move forward, and never leave our community behind. There's no reason for it. We've proven that we can go past that when we're stuck at home. So now that we're able to go out into the community again, there is absolutely no reason that we should be leaving anyone in our communities behind.
Hey everybody, my name is Natalia Soler and I am the Florida Organizing Coordinator for Poder Latinx. I want to talk to you a little bit about what paid leave is and why it is so important for our community to have. Paid family and sick leave is the ability to take time off to take care of your physical and mental health, to be able to take care of a loved one like your child or your partner, to be able to heal from trauma or abuse, and to be able to take care of unexpected situations that happen in life. It is so important for a community to have this benefit because it provides stability and increases opportunities for personal and professional growth. Having paid leave provides economic security and teaches our next generation that putting our health as a priority not only benefits ourselves, but everyone around us that we encounter. Life is full of unexpected changes and bumps in the road, and sometimes things that are out of our hands can leave a big dent in our well-being. We should not have to worry about losing our job or receiving a decrease in pay because of situations out of our control. We know that every day somebody somewhere is struggling to make ends meet and pushing themselves to the point of no return. This does not help work productivity or morale. It does not help themselves or their loved ones or their community. And it decreases the chances of their business reaching its full potential. Now, reducing the spread of illness and improving public health is the way to move forward. Paid leave saves jobs, paid leave saves lives. And as being the only industrialized country to not have it, we need to start making some changes that would not only benefit every single person in this country, but also the next generation to come. Thanks.